Amen. I'll now invite Dr. Alison Hughes, the PI for Afri-SET Project, to introduce the Dean of the School of Physics, Physical and Mathematical Sciences, to give us a statement.
Good morning. So the rep of the CEO, the CEO of the Ghana Environmental Protection Authority, the Dean, distinguished ladies and gentlemen, participants. It's an honor to stand here to introduce to you the Dean of the School of Physical and Mathematical Sciences of the University of Ghana. So our Dean is Professor Otu-Larbi. He is a professor of probability theory and mathematical statistics at the University of Ghana, with over 15 years of experience in higher education sector in Ghana. Our Dean is a product of the University of Kaiserslautern, that's German, where he earned his master's degree, and then he moved on to the University of Bath in the UK, where he earned his PhD degree. He is a seasoned academic with a proven track record of research and teaching at the tertiary level. He was the head of the Department of Statistics and Actuarial Sciences from 2015 to 2022. He's also been the science assessor on the College Appointment and Promotion Committee of the College of Basic and Applied Sciences of the University of Ghana, and also an external examiner at the Charter Institute of Bankers, Ghana. Our Dean is well noted in the international scene for his numerous publications, and then he's also been an external assessor and examiner for several universities in Ghana and Africa. And on this note, I would like us to welcome Professor Otu-Larbi to give us the opening statement. Prof.
Thank you. This introduction is yes, it's encouraging, and I'm happy about that. I think this is the second time that I'm attending this workshop. The last time I met most of you here, I think it was held in West Ghana. And it's Amoah workshop. Okay. So first, the Chief Executive Officer of the Environmental Protection Authority being represented by Madam, and then the country lead Clean Air Fund, all resource persons, participants, the media, distinguished ladies and gentlemen, good morning. On behalf of the School of Physical and Mathematical Sciences of the University of Ghana, it is my distinct pleasure to welcome you all to the official opening of the 2026 Afri-SET International Workshop on Air Quality Data, Air Sensors, and Computational Tools. This important 4-day workshop is being hosted by the Department of Physics, and we are delighted to receive participants from academia, government institutions, industry, civil society, and international partner organizations from Africa, across Africa and beyond. I am especially pleased to welcome the many students and early career researchers joining us. Your participation reflects the growing interest and commitment among young African scientists to address some of the continent's most pressing environmental and public health challenges. It also aligns strongly with the University of Ghana's Strategic Plan 2024-2029, which emphasizes transformative student experience, research excellence, innovation, and impactful engagement with society. Ladies and gentlemen, air pollution remains one of the most serious parts under mentioned environmental threats facing Africa today. Across many African cities and communities, millions of people are exposed daily to poor air quality arising from transportation emissions, biomass burning, waste burning, industrial activities, dust events, household fuel consumption, and rapid urbanization. Despite these realities, many African countries still face significant challenges in air quality monitoring infrastructure. Long-term data availability, technical expertise, and analytic capacity. Without reliable data, effective policy interventions become difficult to implement. Furthermore, without strong scientific capacity, sustainable solutions remain limited. It is within this context that Afri-SET, the air quality sensor evaluation and training facility for West Africa, plays a vital role. Afri-SET represents an important regional effort to strengthen air quality monitoring, sensor evaluation, technical training, and scientific collaboration with West Africa and the broader African regions. Through initiatives such as this workshop, Afri-SET is helping to build the next generation of African expertise in air quality science, data analytics, environmental monitoring, and evidence-based decision-making. This vision resonates deeply with the aspiration of the University of Ghana Strategic Plan 2024-2029, particularly its commitment to positioning the university as a research-intensive institution that contributes directly to sustainable national and continental development. The strategic plan places strong emphasis on interdisciplinary research, digital transformation, innovation, sustainability, institutionalization, and partnership that address Africa's grand challenges. This workshop embodies all these priorities. Over the next 4 days, participants will engage in discussions and practical sessions covering air quality measurements, low-cost air sensor technologies, calibration and validation approaches, computational analysis tools, data interpretation, modeling techniques, machine learning applications, and the use of scientific evidence to support environmental policy and public health actions. Importantly, this workshop recognizes that addressing air pollution requires interdisciplinary collaborations. Scientists also cannot solve this problem. Scientists alone cannot solve this problem, Policymakers, health experts, and data scientists, regulators, educators, civil society organizations, and communities all have a critical role to play. Such collaborative approaches are central to the university's strategic vision of fostering impactful partnership and translating research into meaningful societal outcomes. As a school committed to advancing scientific research and innovation, the School of Physical and Mathematical Sciences is proud to support initiatives that connect research directly to societal needs. The growing intersection between physics, environmental science, data science, public health, and policy demonstrates the evolving role of scientific institutions in national and regional development. It further reflects the university's strategic commitment to nurturing innovation ecosystem that supports evidence-based policymaking, entrepreneurship, and sustainable development. Ladies and gentlemen, I would like to commend the organizers from the physics department, the leadership and technical teams of the Afri-SET, collaborating institutions, sponsors, facilitators, and all partners who have worked diligently to make this workshop possible. Your dedication to capacity building, scientific advancement, and regional cooperation is highly commendable. To all participants, I encourage you to engage actively throughout the workshop. Ask questions, share experience, build networks, explore opportunity for collaboration. Some of the strongest scientific partnerships and innovations emerge from conversations and interactions during gatherings such as this. Africa must increasingly become a producer of high quality environmental data and scientific knowledge, rather than merely a consumer of external solutions. We must strengthen our research systems, develop content-specific technologies, train experts capable of addressing African environment challenges using African-led approaches. The aspiration aligns strongly with the University of Ghana's commitment to the thought leadership, African-led scholarship, and then global impact. I believe this workshop represents another important step in that direction. I hope that by the end of this 4-day workshop, participants will lead with enhanced technical skills, stronger professional networks, new research ideas, and a renewed commitment to improving air quality and protecting public health across our region. Distinguished ladies and gentlemen, with this remark, it's my honor to officially declare the 2026 Afri-SET International Workshop on Air Quality Data and Air Sensor and Computational Tools open. Thank you, and I wish you all a successful and impactful research.
I'll now invite the Environmental Protection Authority CEO, but she sent her representative to stand in for her, who is in the name of Madam Engineer Selina Amoah. Can we please give her a round of applause as she comes to give us the opening statements. Thank you.
All right, thank you, Madam Moderator, and good morning. I want to stand on the protocol already established by the team, and I bring you greetings from my Chief Executive Officer, who would have loved to be here herself, but she has to attend to other equally important engagements. So I read the statement on her behalf. I have the singular honor to deliver this important statement at the Air Quality Air Sensor and Computational Tools for West Africa Workshop, Training Workshop here at the Monarch Hotel, East Legon. Ambient, that is outdoor, and household, which is indoor, air pollution remains among the leading environmental causes of premature deaths in Africa, surpassing even malaria and HIV in their public health burden. According to the State of Global Air Report 2024, air pollution was responsible for approximately 8.1 million deaths in 2021. The burden of air pollution is disproportionately borne by children, the elderly, the individuals with underlying conditions such as respiratory issues. The report further revealed that more than 45,000 children under the age of 5 years die each year across Africa due to air pollution-related illnesses. This represents one of the highest regional child mortality rates in the world. In sub-Saharan Africa alone, over 500,000 children under 5 years have died from pneumonia, a disease to which air pollution is a major contributing factor. Distinguished participants, the situation in Ghana is equally concerning and should not be taken for granted. Results from the Environmental Protection Authority's air quality monitoring activities reveal particulate matter concentrations that exceeds the national air quality standards in most of the monitoring locations. Additionally, virtually the entire population in both urban and rural areas is exposed to particulate matter concentrations that exceeds the World Health Organization's guidelines. The World Health Organization estimates in 2017 indicated that air pollution contributes to approximately 28,000 preventable deaths in Ghana annually. In the Greater Accra metropolitan area alone, about 2,800 premature deaths were attributed to air pollution in 2015, and this figure is projected to rise to 4,600 by the year 2030 if urgent interventions are not implemented. The economic consequences are also enormous. The estimated annual economic cost of indoor and outdoor air pollution in Africa is approximately $250 billion. In Ghana, the economic burden associated with air pollution has been estimated as $2.5 billion, representing approximately 4.5% of the country's gross domestic product, according to the World Bank Country Analysis Report for 2020. Ladies and gentlemen, there is therefore an urgent need to address the growing burden of air pollution-related illness and deaths. This can be achieved through measures such as advocacy and public education to encourage attitudinal change and discourage indiscriminate environmental pollution, including open burning of waste and improper waste disposal. Promotion and adoption of cleaner fuels and cleaner cooking technologies. Proper vehicle maintenance and adoption of environmentally responsible driving practices. Strict enforcement of environmental laws and regulations. Expansion of the National Air Quality Monitoring Network to support data collection, scientific research, policy formulation, and evidence-based planning and implementation, and sanction environmental or pollution violations and irresponsible behaviors. Distinguished participants, despite the challenges, Ghana has made significant progress in air quality management over the years. Some notable achievements include the following: the publication of the Air Quality Management Regulation in 2025, the LI 2507, the development and deployment of the Ghana Air Quality Portal or dashboard to stream real-time air quality data and improve accessibility for research, students, NGOs, and the general public. Being the first country in the West African sub-region to undertake extensive air quality monitoring, expanding from 8 regulatory grade monitoring stations established in 2005 to 15 regulatory monitors and 28 low-cost sensors deployed across 5 major cities, including Accra, Tema, Kumasi, Sekondi, Chakradi, and Tamale between 2018 and 2026. Being one of the few countries in sub-Saharan Africa that took an early step to phase out leaded gasoline, and the first country in West Africa to undertake baseline studies on lead concentration in air, soil, and blood among high-risk populations. Being the first West African country to move to low-sulfur diesel, and with a new sulfur content standard of about 50 parts per million, down from 3,000 parts per million. The development of strategies and policies promoting cleaner bus standards, soot-free transport systems, electric mobility, and fuel efficiency. The publication of the National Motor Vehicle Emission Standards and the Ambient Air Quality Standards in 2018. The development of the Greater Accra Air Quality Management Plan, which was relaunched in 2024. The establishment of state-of-the-art air quality monitoring station at the University of Ghana, Legon, St. Joseph's Roman Catholic Basic School at Adabraka, with an additional station to be installed at the VRA office in Tema industrial area. Ghana is now among the few countries in West Africa with the technical capacity to operate advanced federal equivalent monitors capable of generating real-time data on particulate matter, black carbon, and meteorological conditions. Ladies and gentlemen, I would like to encourage researchers, academia, civil society organizations, and NGOs to make full use of the information available on the Ghana Air Quality Portal for epidemiological and health assessment studies, knowledge sharing, and public awareness creation on the health impacts of air pollution in both urban and rural communities. Distinguished participants, the Environmental Protection Authority remains fully committed to strengthening air quality management in Ghana. The EPA will continue to collaborate with local and international partners to expand air quality monitoring networks across major cities and support the effective implementation of the Air Quality Management Regulations 2025, the LI 2507, in order to reduce the disease burden associated with air pollution in the country. There is much we can do collectively to improve air quality. We must all play our part, being as government institutions, academia, industry, civil society, and citizens alike. Together, we can have the opportunity and responsibility to ensure that our children, the elderly, and the future generations breathe cleaner and healthier air. I encourage all participants to actively engage in the workshop, to build the needed expertise and network to effectively tackle air pollution. The authority will be happy to receive any recommendation from the discussions for its study and possible adoption. I wish you all fruitful deliberation at this workshop. Thank you very much for your attention.
Permit me to introduce once again our PI for Afri-SET Project and the reason for our gathering here. Let's invite Dr. Arku to give us his opening statement. Thank you, Doc.
Thank you, moderator. I think that was an elaborate introduction. So I have the privilege to just give you a brief overview of what we call the Afri-SET Project. And I hope that this will give an insight to where we started from, and also where we are, and also where we hope to go. And so on this note, ladies and gentlemen, I want to begin by saying that there's a need, and we met this need of having a center that is able to evaluate low-cost sensors. Why was this needed? It was simply because of two main obstacles that we face here in Africa. The first one is the lack of what? Capital. Investing in reference monitor as tend to record similar values of what the very expensive reference monitors does. But the problem with this is that the sensors tend to either overestimate or underestimate the reference monitor. And so if you want to make any meaningful policy, or you want to be able to look at the reliability of the data, then it's important to understand these sensors, which are becoming quite popular in sub-Saharan Africa. And also, these sensors are mainly calibrated in the global north, where the sources of pollution are quite different from what we experience in Africa, while the meteorological conditions are also a bit different from what we experience here. And so it became important to try to get a center or a facility established here in Africa. And so the journey started from where the Ghana Environmental Protection Agency, in collaboration with the Department of Physics, had some support from the World Bank to set up these very expensive reference monitors. And so after that, we decided, the EPA, the Department of Physics, the University of Cape Coast, and then also we had the US EPA and the University of Columbia University to come together to do a pilot after we had these reference monitors installed. As Madam informed you, there are two of them. One is at the University of Ghana, where the Department of Physics is hosting on behalf of the EPA, and then one is at the St. Joseph Catholic School in Adabraka, where that monitor what is occurring in the city. And so this was a pilot project to do some inter-comparison of some sensors. And so it started from here, where we tested these sensors against the reference monitor and published this paper in 2023. And so this gave us an idea that if we could do this inter-comparison, why don't we set up a facility to evaluate low-cost sensors. And so the goal is that this will be possible. We also decided that once we do our evaluation, we will have a website dedicated for our reports, our calibration protocols, and any other materials that we will generate, so that the general public will be able to go there and get informed. And this website was to be both in English and French. And the address is www.Afri-SET.org. So you can go there and see what we have. So what do we do when we reach out to manufacturers? We ask them to send us at least 3 of the same sensor. So we want 3 identical sensors, and that is obvious. I mean, for those of us who are scientists, we know that the more data you get, the better your outcome, or the better the reliability of the measurements. And so we did that. Then we decided to evaluate 6 weeks in the dry season, which include the Harmattan period, which is very common in West Africa, and then 6 weeks in the wet season. we are a bit unique because of the way we do our evaluation. They take 2 months and any period in a year, but we want to look at in the seasons that we find ourselves. I hope you can see this. The light is not too clear, but this was the beginning when we had the World Bank giving this facility to the Ghana government through the Environmental Protection Authority. Maybe we can just switch this a bit so that you can see. Good. Yeah, and so it coincided with the COVID period. The contractors from the US could not come. And the World Bank had a timeline. And so together with staff of the Environmental Protection Agency and the staff of the Department of Physics, we decided to take on the task of installing these very expensive reference monitors and a Met Tower. We had several meetings with the provider to give us detailed training. And so we did this, and I want to assure others from other countries that we have the capacity now. If you have a reference monitor, reach out to us, we can install them for you. I think that was the good thing about COVID. It gave us the facility. Otherwise, they would have come and installed, and we would just look on. So this is where we came from. 2022, we see that it was just a reference monitor sitting there. We didn't have any sensor. EPA also had their filter-based monitors, the millivolts and the ARA. And so we decided that based upon the pilot that we did, we should reach out and get to ensure that the facility is put to use, and also to ensure that we could be able to sustain the reference monitor along with the EPA. And so we've moved on 2025, 2026 now, and hopefully this afternoon some of you will go to the department to see the setup there and physically experience what we have there. So these are just some of the sensors that we have evaluated at the site. Sorry. Yeah, so these are some of the sensors we evaluated so far. This is the website, both in English and French. You can visit Afri-SET.org. And we've had manufacturers from various countries. In Africa, we have manufacturers from Kenya and Uganda. And then also we have from across the rest of the world. The second objective of Afri-SET is one of the reasons we are here this morning. And that is to build capacity of students and practitioners in Africa. And so what we set out to do was to have a minimum of 25 persons to train. I believe if you look across this room, we are more than 25. So from the time we started, we always had more than 25 persons. And we try to bring people from across West Africa each year. We also organize virtual training and webinars, and then all our training materials, we have it on our website and also social media. So this is where it started. This project was launched in March 2023 in Kigali, Rwanda, because it's a joint project between the Department of Physics, University of Ghana, and the Carnegie Mellon University Africa, based in Kigali. And so it was launched there, and subsequently, every year, as the Dean mentioned, we've had this training workshop. I think some of you may see yourselves in some of the photos there. if you look. But usually it's in January, but for this year, we had some other activities that made us, we could not have it in January. And so if you go to our YouTube channel, you will see all the materials, all the videos, and you can go through on your own. And this one will also be placed there. Yeah, so just, I think it went too far. Yeah, so we do webinars, we do physical training, people come into our labs, we train them and help them to understand how these sensors work. We had visitation from international participants. ISIC is the Air Sensor International Conference, which was held here in Accra. It was the first time coming to Africa and was held in Ghana. And we had a participant visiting the centers to engage and see how we do our operation. We also had some visitation from the U.S. State Department to come and see what we do, because we collaborate with the U.S. Embassy here in Ghana. The third objective is to look at the long-term sustainability and to replicate the center. We try to explore more funding for this project because we don't think that it should become a white elephant, as the term goes, when the Clean Air Fund pulls out. Incidentally, Clean Air Fund had to fund us for 3 years. We are now done with the 3 years. Fortunately, they've given us an extension for another year, and so we will still continue to work. We are looking at maybe partnering with the Environmental Protection Agency to maybe take over the lab or bring funding so we all work together, because it's important and look out to private sector and others. So we are eagerly looking for funds to keep the facility running. We are trying to also see if we could monetize some of our activities, you know, and we've been doing all of this free for the manufacturers. But some of the manufacturers have started coming to us that they want specific things to be done. And so we don't think that we can do it for free. So we may put in some cost. And also maybe start some consulting services where we can be able to also raise funds to keep the center. On the pictures there show some of our staff, which we decide to always build capacity. So we also send them out for training in France, in Norway, and also in the USA. And we do this continuously. Now, the future activities. We talk about sustaining this and replicating it. So we want to establish another Afri-SET. This is Afri-SET West. Fortunately for us, this year we are establishing Afri-SET South. So we are going to have another Afri-SET in South Africa. The Clean Air Fund has opened an office in South Africa, and the folks in South Africa have decided to start Afri-SET South. So this year we'll have a replication. We know there are interests in East Africa and in other parts of Africa, even West Africa. We had some advances from folks in Nigeria. They also want to start an Afri-SET there. So we are open to collaborations. And now, what we intend to do is to build more calibration models for each of the sensors we evaluate, because we realize that sensors in the dry season, in the wet season, and even in Hamilton behave differently. And we'll get to see some of those results throughout these 4 days. We also want to focus a lot more on our training and capacity building. And as I said, we are opening up in South Africa. I don't know yet, maybe the next conference may be a joint one between West Africa and South Africa. That is a possibility, or we will still maintain ours here. And then what we try to do is also to make the center available for other Africans who are developing sensors, and you will get to see a few of them. There's one from Nigeria, Mary, I think. Are you here? Yes. So they have developed their own sensors now in Nigeria, and it's on a test at Afri-SET. We have another company in Ghana, Crafted Climate. They have also built their own sensors, and we are also helping them to evaluate it. So things are getting better. We hope to have sensors from other countries here, and we are always available to test your sensor and evaluate it and give you their report. So to conclude, our reports are generated, it's put on our website, and you can visit there. Our calibration models will be out very soon. We decided to do something unique. We did not want to just put a calibration model out there. Because we are, researchers, we are in the scientists, we are academia, we want it to be vetted. So very soon, we will have it published. In fact, it's now under review with a very reputable journal, so that when we put it out, we know that we are putting out something which is credible. So look out for that publication, and then you will then have it all on our website, where if you have the data, raw data, you put it into the models, it comes out calibrated, and then you can use it for research. Otherwise, data from local sensors, as I said, if you look at what is going to be presented, some of our results, you see that they highly overestimate or underestimate. In fact, one sensor that was very, very, they always used to, during the Hamilton, put out results that Accra was the most polluted city in the world. We got that sensor, we evaluated it, and I think the company have now tried to adjust the model. They were always giving us results far in excess of the reference monitor. And so we reached out to them, and we have worked with them to look at the model again, so that they don't give these sensational readings. Our next step, again, 2026 Micro Sensor Challenge. Yes, we have concluded the measurements of the Micro Sensor Challenge. Micro Sensor Challenge is organized every 2 years by Air Paris in France. Last 2 years it was with Paris and Bangkok. This year is with Accra, Paris, and Bangalore. So 3 cities, 3 continents, same sensor, we are evaluating them. And I forgot to tell you that for our evaluation, we do not rank manufacturers. We just put out our results. All right? But for the Micro Sensor Challenge, they are going to be ranked, and the best will be given an award, which I believe will take place somewhere in September during the Clean Air for Blue Skies Day, or the Air Pollution Day. So that will be done, and we'll reach out to most of you to patronize that. We have a sensor known library with support from Amazon Web Service, which you will hear about during this workshop. We should have launched it last year. We had some delay with customs. Hopefully we've now gotten all the sensors. So these sensors will be available for students' projects, for research, for community groups. All you do, you put in the request, you need a number of sensors, and then we will vet your concept note, and the sensors will be given to you. We will pilot it here first in Ghana, and then subsequently we'll open it for West Africa. And so this is, I think, another project that we hope to be able to help collect more data, because as we said, there's scarcity of data. So we want a lot of people to be able to understand what is happening in their locality. Students who want to do project, masters, PhD, will have sensors available for them. And then we have the last one there, we team up with a university in Liberia, okay, and United Methodist University, and we're able to get some funding from the EPIC Fund, University of Chicago, to deploy some sensors in Liberia, and this project is ongoing. But it started off from this workshop. We had people from Liberia who came and said they have no monitor. And so based upon that, when we got to know of EPIC Fund, we approached them and were able to get now some grant to have monitoring in Monrovia, Liberia. I think the lead for that project is sitting there. Sheikh, can you wave so they'll see you? Yeah. And based upon this, the EPIC Fund has now given an award to the Clean Liberia project for the good work that they have done there in a short space of time, and they will be receiving this award in South Africa in July, when we have the there's a program that is common now called the Clean Air Forum, which have moved around. The first one was in Kampala, Uganda. Next, we had it in Lagos, Nigeria. Last year, it was in Nairobi, Kenya. This year is going to Pretoria, South Africa. We are lobbying that the next one will come to Ghana. So hopefully, we'll see if that is possible. So I think this is acknowledgement to our partners that we've worked with over the period. And let me state that the Environmental Protection Agency has been our partner. In fact, for more than 2 decades, we've worked with the EPA. And you note that the current Chief Executive Officer of the Environmental Protection Authority is my former head of department, Professor Nana Amabram-Kluche. She was the immediate past head of Department of Physics, and Madam Selina, we've worked with her and the rest of the staff at the EPA. And we hope to continue this partnership to be able to get all of us to breathe cleaner air. So I thank you for this. You can visit our social media handle and let us talk and network and see how best we can ensure that we have a cleaner air to breathe in the whole of Africa. I thank you for this, and then is there time for questions or something, or we can just break? Thank you very much.
Thank you very much, Dr. Alice Hughes. I think we can have 10 minutes question time, and then we break for group photo, and then we have a short snack. So if anyone has any questions.
Oh, yes, please. Sorry. Thank you very much for your presentation, Doctor. My name is Oscar J.
from Kitapo Afri-SET. My question is, I noticed that for the future plan, there is a plan for East Africa, South Africa, but North Africa was not covered. Is there any plan for the northern sector? Thank you.
So quickly, I mean, anyone who is open to get this concept. So this was more of a proof of concept, because even our own funders, they didn't believe we could, carry this out. And now Afri-SET have become a flagship project for the Clean Air Fund. And recently, just I think 2 weeks ago, we were at ASIC in California, and we're on the plenary of the ASIC, and we're represented by our research associate sitting at the back there, Mr. James Nimo. And after his presentation, we've received so many people getting to us that they want to work along with us. So we are open for any part of Africa, Central, North, any part. It's just that we don't have funds, but we have the concept that we are willing to transfer this knowledge. Yeah, that's another.
Thank you so much, Doctor. My name is Otu-Larbi from Colibris. First, I would also want to commend you and the team at Afri-SET for all the wonderful work you've been doing. And now should I say a question? It's for Afri-SET. Is the team looking beyond evaluation to manufacturing? Because I know you made mention of ways to generate revenue. So, or would that be a conflict of interest for Afri-SET? Thank you.
Yeah, we have tried to get funds to see if we could manufacture sensors. Because in this training, you also get to your hands on how to build sensors. So we are looking out for collaborations, we are looking out for funding to build sensors. Maybe the EPA will be one of those that will highly benefit if we have these sensors, so that they can easily deploy throughout the entire country and build have a network of sensors to be able to get the information out on time, especially when there are high pollution episodes. So we are indeed doing this. And then also we are also working with the EPA to see areas where we need to deploy some of these sensors, because sometimes after the evaluation, the manufacturers say keep the sensors. And so we want to move the sensors away from our facility into the community to be able to get more information. So some of the manufacturers are telling us where they want the sensors, maybe deploy at schools, deploy in the community. So we will work along with the EPA, since they have a roadmap of the areas that they need to have more sensors deployed.
Thank you, Dr. Yush, for the splendid presentation. My name again is Sheikh Sherry from Liberia, and congratulations to you and the Afri-SET team for the tremendous work done. I just wanted to ask a question related to the sensor library. When these loans are given out to researchers and students, is it a mandate to return them back? And under what conditions? What happens if some of those sensors become faulty in the few while in use? Who is going to be responsible for its replacement? Because the request is going to be specific on numbers. And how does that affect the research by those loanees and things like that? Do you have some remedy in place to ensure that what you give out serve its purpose and it does not affect the works of those that will be using them based on maybe factory faults or something like that. I just wanted to understand. Because after you wrote this out in Ghana, based on your experience, you are going to be opening up for international participation and availability. I just want to understand how this is going to work. Thank you.
Yeah, thank you. We have that on the program. I think that will be either on Wednesday or so, where we'll have a detailed outline of how the loan process is going. But it's just like how we all have used libraries before. This one, we are not going to get books, but we are going to get sensors. And so the sensors are available. We don't have unlimited number of sensors. So that's why it's important when the portal is open on our website, people will go there, apply, and then there are conditions. It's just like you go to a library and you borrow a book and you don't take good care of it. There are some little things, but we all know that these are electronics, so we ensure that we give you the right training before you take the sensors out. And we are also hoping that this is a pilot, and subsequently we'll then be able to generate get more sensors from manufacturers. In fact, from the report given to me by my research associate, James, there are other companies now very, very interested, because you know the manufacturers, they are also looking for markets. And so he gave me a report that one of the major manufacturer sensor is saying that why didn't we approach them? They are willing to give us a lot of more sensors. So hopefully when we start this and other manufacturers see that their competitors have contributed sensor to the loan, they will also start giving it, and then we'll have these more sensors to give out. So there's a section in this workshop where you will hear more about the sensor loan library and more details. Yeah.
Okay, thank you, Doctor. I am Edward Arku, Ghana News Agency. I'm sitting in for my colleague Albert. So you will come later. I'm only covering the opening ceremony and making sure that whatever I discuss here is also reported. So I'm asking this question in my capacity as a journalist, and I'm asking whatever you say will be on record. So I'm looking at life after the Clean Air Fund support. This appears to be a national exercise. Do you want the government of Ghana to adopt this project? And if yes, what will be the benefits for the public?
Okay. Yeah, thank you. The name again? Edward, yeah. Edward, thank you. I think that as the Dean for the School of Physical and Mathematical Sciences said in his opening statement, that this is part of the strategic plan of the University of Ghana to be able to do research that will be relevant to the nation and even beyond. And so this issue of air pollution is a very serious one that we face daily. And having an information on the quality of air that we encounter when we leave our homes, or even within the home, is quite important, because we can save lives. And so this project is one which I believe should be sustained, and it has a lot of benefits, because this will ensure that even if the market is to be flooded with sensors for manufacturers, we will ensure that only sensors which are reliable will be, brought into the country. And so we are in talks with the EPA because they give the permission along with the Ghana Standard Board to bring in these sensors. We don't want junk, which will come and then give you very wrong readings and may cause you to even panic and go on. Community citizens will go on a demonstration because they think that the reading they are getting from the sensors that someone has brought in is the right reading. So ours is to ensure that sensors which come into the country or on to the continent is the right type of sensors, and that the data from those sensors are reliable. Because with reliable data, government is able to then come up with policies to be able to protect citizens, to be able to protect the environment as a whole. So this is a very important activity that needs to be sustained. Thank you.
Thank you very much, Dr. Allison. Can we give him a round of applause? I think Amoah is the director and head of the Environmental Quality Unit at the Environmental Protection Authority, Ghana. She is an accomplished environmental engineer and currently serves as the acting director and head of the Environmental Quality Unit at the Environmental Protection Authority. She has contributed significantly to national efforts aimed at addressing urban air pollution and strengthening regulatory frameworks to safeguard public health and the environment. In this role, she provides technical leadership in the development and enforcement of environmental standards, with a focus on air quality management, emissions control, and environmental monitoring. Engineer Selina Amoah is also actively engaged in stakeholder collaborations and policy dialogues, supporting evidence-based approaches to environmental governance, particularly within fast-growing urban centers such as Accra. With a round of applause, let's invite Engineer Selina Amoah to do the first presentation for us.
Okay. Anyway, thank you. So my job is to take us through the legal and regulatory framework for air quality management. So we look at some policies, other legislations, standards, and then some international obligations relating to air quality. So in terms of policy, the 1999 Constitution places onus on the state to take appropriate measures to protect and safeguard the national environment for both the present and then the future generation. And then it also places onus on every citizen to also protect and safeguard the environment. So the state has its responsibility, and then the citizens also have responsibility to protect and safeguard the environment. Now, the National Environmental Policy 2012 gives direction on the constitutional mandate of Ghana to protect and safeguard the environment. And then it details the various strategic goals and objectives on sustainable resource use, impact management, and then holistic integrated planning. So air pollution is addressed as part of a broader environmental management goal. And this can be found under the subheadings pollution control, pollution prevention and control, where undertakings are required to incorporate measures to control, reduce, and prevent pollution. Under waste management, using waste as a resource. So if waste is being used as a resource, then it means we will prevent the indiscriminate dumping of the waste and rather look at opportunities to turn them into useful products. Then energy resources, where it looks at promoting renewable energy and then creating public awareness on energy resources, is looking at renewable energy, and then the other aspect is on awareness creation, where the public awareness is also seen as one of the major steps to control pollution. Okay, the environmental sanitation policy also aims at improving health and living standards of the citizen through waste management, sanitation infrastructure, and hygiene practices. So the framework for managing waste and maintaining a clean and safe environment is also outlined in there. And then it promotes integrated waste, both liquid and solid waste management. It has identified institutional capacity building as one of the key steps to promote the public health from waste management practices, and then private sector involvement and behavioral changes. Then industrial policy, which emphasizes the need for cleaner production and environmental sustainable industrial practices. The aspects that relate to managing air pollution efficiently includes the promotion and adoption of environmentally friendly technologies and improved manufacturing processes to reduce pollution. And it encourages efficient use of raw materials, energy, and water in industry. So that can also help in reducing pollution, in that the extraction of raw materials and the processing, it uses resources which might also result in the release of emissions into the environment, as well as the energy and then water. And then it encourages industries to develop and implement self-regulatory measures on environmental management. And this includes strategies to minimize air pollution. Then the transport policy, which addresses air pollution through strategies aimed at reducing greenhouse gas emission and promoting sustainable transport practices. And the focus areas include promotion of sustainable transport, and it's looking at mainstreaming green infrastructure, climate change, and sustainable issues to transport sector activities. On improved vehicle technologies, it's looking at undertaking research into vehicle and fuel technologies to identify those most appropriate for the region, with a focus on reducing emission. And then traffic management is focusing on better traffic management and increased use of mass transit system to reduce congestion and then the subsequent pollution that comes from the from that area. And then integrated land use and transport planning encourages mixed and integrated development of the built environment to reduce the need to travel and mitigate congestion. And on non-motorized transport, the policy is looking at integrating non-motorized facilities in transport infrastructure development to promote walking and cycling, which are non-polluting modes of transport. Then the National Electric Vehicle Policy 2023, which fulfills the Ghana's commitment to address climate change, is looking at promoting the widespread adoption of electric vehicles and then provide a framework for addressing key global and local issues associated with vehicles fitted with internal combustion engines. So that is for the electrical policy. Then the energy policy, which is also focusing on ensuring sustainable exploration, development, and production of petroleum, increasing the proportion of renewable energy in the total energy mix, and promoting waste to energy by converting waste generated from municipal activities, industrial operation, and agriculture into waste. And the policy is also looking at promoting energy efficiency and conservation. Then the climate change policy is also there, and it's looking at ensuring a climate resilient and climate compatible economy whilst promoting sustainable development. And the three focal areas that the policy is focusing on is effective adaptation, social development, and then mitigation. And then there are some program areas that has been identified for implementation. Then the Environmental Protection Authority Act 2025, the Act established the Environmental Protection Authority to regulate, protect, coordinate, and exercise general oversight over matters relating to climate change and the environment. And this replaces the Act 490 that we knew in the past. The functions of the authority under this new act includes to ensure compliance with any laid down environmental impact assessment procedure in the planning and execution of development projects, including compliance in respect of existing projects, issue environmental permits for undertakings to control the types, the volume, the constituent and effect of waste discharges, emissions, deposits, noise, or any other source of pollution and of substances that are hazardous or potentially dangerous to the environment. And the authority is also to ensure releases and discharges of harmful substances from any activity into the environment does not exceed what is prescribed in the standards that has been issued. And it's also to issue notices in the form of orders, directives, procedures, or warnings to ensure compliance of the Act, and promote the adoption of new environmentally sound technologies, including cleaner production and resource efficiency, and also circular economy. The other function is to promote research and carrying out studies, surveys, and analysis, and disseminate information on the findings to protect the environment, carry out environmental quality monitoring, collaborate with relevant stakeholders to develop comprehensive national database on the environment, conduct investigations in collaboration with other stakeholders into environmental issues and issue enforcement, prescribe environmental quality standard and guidelines relating to the pollution of air, water, land, and any other form of environmental pollution, and also create awareness on environmental issues. The Local Governance Act, which provides for the local governance in accordance with the Constitution and the National Development System, defines and regulates the planning procedure of the district assemblies and other related matters. It mandates the assemblies to enact bylaws to abet nuisances, and also mandates the MMDAs to execute certain provisions in the Criminal Offence Act. Then the GRA Custom Act, which is an age-based tax system, penalty on cost, insurance, and freight of overage vehicles. So vehicles that are imported into the country, when they are more than 10 years old, between 10 years and 15, they pay penalty on cost, insurance, and freight, 5% of the cost, insurance, and freight. That is 5% for private vehicles and then 2.5% for commercial vehicles. When the vehicles are between 12 and 15, it's 20% and 10% for commercial. And then over 20 years, it's 50% and 15% for commercial vehicles. Then the National Petroleum Authority established the National Petroleum Authority to regulate petroleum downstream industry in Ghana. And then their functions include regulating the importation and refining of crude oil, the sale, marketing, and distribution of the refinery products. Then the fees and charges miscellaneous provision provides for the required processing and permit feed for different institutions in the country. The Environmental Protection Assessment Regulation, the LI 2504, also replaced the LI 1652 that we knew in the past. And it regulates the conduct of environmental assessment and the issuance of environmental permits in Ghana. It makes it mandatory for all activities that may impact negatively on the environment to register with the authority and then obtain permits. So the details for the acquisition of the permit are all spelled out in the LI. And in addition to that, the applications or the applicants are also required to indicate their clear commitment to climate change mitigation, adaptation, biodiversity conservation, and then pollution control and prevention. The Hazardous and Electronic and Other Waste Classification, Control and Management Regulation, the LI 2250, provides a comprehensive guideline for the classification, management, control, and disposal of hazardous and electronic waste. So anybody who wants to handle any of such material, this LI gives the requirements that any applicant is supposed to follow. Then the Environmental Protection Effluent Regulation, we know we have standard for effluent. Somebody may ask, we're talking about air, why do you bring effluent? Because some of the air emissions are also generated from the handling of the effluent. So the effluent needs to be handled sustainably to reduce the emissions from its management. So the LI 2506, which is the effluent regulation, is to help implement the standard that has been developed for the discharge of effluents, to control wastewater discharges into the environment and collaborate with stakeholders for effective control to protect public health, the ecosystem, and also water resources. Then the Air Quality Regulation, which was also passed in 2025, the LI 2507, is to help implement the Ghana standard for ambient air quality point source or stack emission, the GS 1235, and then the Ghana standard for motor vehicle emissions, the GS 1219. It's also to help improve air quality in the country by controlling emissions from various sources, including industry, motor vehicles, and ensuring compliance with the standards, as I have mentioned. The regulation also requires the development of an air quality management framework, which will provide for the development of an air quality policy, air quality management plan by district assemblies. It's also to establish a national air quality information management system with a dashboard to facilitate routine reporting. The regulation is also to help harmonize sampling protocols and test methods to align with the Ghana standard. And under the regulation, vehicles are also required to be tested and issued with emission compliance certificates, which will be used as one of the requirements for the issuance of the roadworthy certificates. And there are also sanctions that are indicated there for non-compliances. The Ghana Road Transport Regulation regulates the registration of vehicles and provide other conditions required for vehicles to ply on the roads. The vehicles are required to be fitted with pneumatic tires labeled temperature class A or B, which are for hot weather, and not the C, which is for cold weathers. Then the tires should be of specific size to withstand the maximum permissible load. The tires more than 4 years from the date of manufacture are not supposed to be used. The tires should not be under or over inflated, and the vehicles must not exceed the permissible axle load and gross vehicle weight. We know that the emission from vehicles is not only the combustion, but the driving practices also impact on the emissions. Then the Ghana standard for health, environment and health protection, the requirements for ambient air quality, point source or stack emissions, the JS 2012-36, specifies the requirements for air quality and point source emissions and give guidance for discharges into the ambient environment. And it provides the parameters that are required to be monitored by different undertakings and the permissible limits that are allowed. The Ghana standard for health protection requirement for motor vehicle emission also specifies the requirements for exhaust emission of motor vehicles, tractors, farm equipment, and mobile or construction machines. And it requires monitoring of emission levels to be carried out every year for private vehicles and every 6 months for commercial vehicles. So these standards also provide the parameters for the various kinds of vehicles, for diesel vehicles, for gasoline vehicles, and then the permissible limits that are allowed. And the standard also specify the standards. We have different categories for vehicles that were in existence before 1995 and then after 1995. It was believed that after 1995, that is when the catalytic converters were introduced. So different emission levels are specified in the standard for those vehicles. Then the Ghana standard for environmental protection requirements for effluent discharges also specify the requirements for effluent quality from industrial sources, wastewater treatment systems, etc. And provide specific, it is sector specific, so each sector and then the set of parameters that are required to be monitored and then the permissible limits. Then there is the motor gasoline standard, which is a national provide a national specification for gasoline that is used in the country. And it provides the parameters for octane levels, sulfur content, allowable trace metals, and this is to ensure compatibility with modern vehicle engines across the country. And then there's also the automotive diesel oil standard, the GS 140, which also specifies the requirements for automotive diesel fuel and outlines the properties, including the maximum sulfur limit, the density range, cetane index, to ensure fuel efficiency and engine protection. Then under international obligations, there is a better air quality agreement that was signed in 2019 or was established in 2009. And it's a regional agreement that was initiated among 9 countries, including Ghana. It provides the roadmap for aligning transport policies and addressing short-lived climate pollutants. And it is being facilitated by the UNEP and the Climate and Clean Air Coalition. Then the Sustainable Development Goals that we all know of. The Goal 3, which is on good health and well-being, target 3.9, seeks to substantially reduce the number of deaths and illnesses from hazardous chemicals and air, water and soil pollution and contamination. Goal 11 on sustainable cities and communities, target 11.6, aims to reduce the adverse per capita environmental impact of cities by paying special attention to air quality and municipal and other waste management. And then Goal 11 on climate action, Goal 13 on climate action, seeks to combat climate change and its impact. So other applicable legislations that are available, there are a number of them. Like we all know, Ghana doesn't have a specific policy on air quality, but all these regulatory and legal framework have something to do with air quality. And there are a number of them. The others include the Ghana Investment Promotions Center Act, the Public Health Act, the Ghana National Fire Service Act, Fire Precautions Regulations is also there, Factories Office and Shops Act, Land Use and Spatial Planning Authority Act, the bylaws on the respective MMDAs. So a host of them, they are all there to guide the air quality management in the country. So that ends my presentation. Thank you for your attention. If there are any questions, I think we can take the questions now. I think they are fine. There are no questions. Because these are policies that we know. So some of us have been using them. We are familiar with them. And all we are saying is that if we talk about air quality management, these are some of the policies that guide us in our efforts to reduce air pollution in the country. All right, Madam Moderator. So thank you very much. I think they are fine. There's a hand.
Thank you so much, Madam. Okay. My question is based on enforcement. I know, you highlighted a lot of some of doing in terms of enforcement of these policies to ensure that people in the community adhere to some of these policies, for them to also understand that there are laws in terms of to management of air pollution and the likes. So I think, that's my question. In terms of enforcement, what is EPA doing? Thank you.
Okay. Thank you very much. We all know that when it comes to enforcement, it's a challenge. That is the major challenge that we have. And I believe it is not only in Ghana, but other countries as well. We have all the policies there on paper nicely, but it is the enforcement that is a challenge for all of us. But what I listed here is not only the responsibility of EPA, but other institutions are also responsible. But from where I'm coming from, EPA, we trying as much as possible to enforce. When it comes to the environmental assessment regulations, for instance, we do a number of compliance enforcement activities. So to go out and then fish out those that are operating without the permits or with an expired permit. Because if you don't have a permit, before the permit is issued, the undertakings are required to conduct the impact assessment. And in the impact assessment, they identify what the likely impact on the environment is and what they are going to do to mitigate that. So if you don't have the permit, then it means that system is not in place. And then the other is where the permit is there, but they are not complying with the commitment in the document that they submitted, which is teased out as permit condition for them. So the standards are there, the Ghana standards that we have, which specifies the permissible limits for releases into the environment. So for ambient air, for effluent, but we didn't have the regulations. But last year, the regulation was passed. So we have started with our implementation plan. We've started with some awareness creation to let people know that the standard is there. Now we have the regulation. The regulation is coming with the sanctions. So if you create the awareness, you try to engage, and then you're still not seeing improvement, then the sanctions may have to apply to see how best we can see some level of achievement from the sector.
Sorry, you also made mention of advocacy. I know EPA maybe in their capacity, yes, of course, we always need support. So are there rooms for maybe, for like from us, which are, NGOs, are there provision or room in terms of support or ways we could collaborate with EPA to drive advocacy? Because I can tell you from experience, sometimes when we are carrying out our work in terms of social awareness, at some spaces too, you find it very difficult because people will feel, okay, where are the regulatory backing in terms of what you're doing? And we've also made effort as well to see ways we could have EPA. So are there provisions to organizations could maybe take advantage of to have EPA to also support the work EPA is doing in terms of advocacy? Thank you.
The provisions are there. I think when I was presenting on the functions of the Act, I did mention, or I don't know whether I escaped, that there's collaboration with local and international partners. So that collaboration is there. So you can always reach out if there is an area that you think that we can collaborate to make more impact. You can always reach out to the authority, because there are a number of individuals and NGOs that are already collaborating with the authority to implement certain aspects of our functions, just to support what we are doing. So if you have an interest, you can always approach the authority and then we can have that engagement. Okay. Madam Moderator, thanks.
We move into the next presentation. After listening to all the regulations and standards, our next presentation is going to look at urban air quality monitoring, a case study among municipalities in Greater Accra. And this will be done by Dr. Fred Otu-Larbi from the University of Energy and Natural Resources, Ghana. Dr. Fred Otu-Larbi is a climate and environmental scientist with over a decade of experience delivering practical climate-focused solutions to governments, businesses, and communities. He is a senior lecturer and researcher at the University of Energy and Natural Resources, Ghana, where he teaches climate change, carbon footprint and sequestration, atmospheric chemistry and pollution. He has been actively involved in air pollution awareness creation and sensitization through projects with Ghana Think Foundation and Clean Air Fund. Dr. Fred holds a PhD in environmental science from Lancaster University, an MS in applied meteorology and climate with management from the University of Reading, UK, and a bachelor's degree in climate science and meteorology from KNUST, Ghana. With a round of applause, let's invite Dr. Fred Otu-Larbi to give us a presentation. Please, you give us a 30 minutes presentation, then 10 minutes for Q&A. Thank you.
Okay. It's always interesting when somebody is reading sometimes you wonder if it's actually, if it's you they are talking about. But yeah. So I in the next couple of minutes, I want to talk about, I'm going to follow on from where Madam Selina left off. So continuing on the side of policy. Okay, so because effectively, all that we are doing, whether we are testing sensors or making measurements and so on, will end on the desk of a policymaker. Somebody needs to take that data, that information you're gathering, and turn it into something that impacts people's lives. And that is the remit of policymakers. And so I'll be talking about how we went about doing something with policymakers, particularly people in the district assemblies across the Greater Accra metropolitan area. My colleague Ivy sitting at the back, Ivy, give them a wave. Ivy has been very instrumental in this work, as has been other people, some who are here and elsewhere. So that's what I'll be talking about, how we've gone about developing an air quality action plan for 13
municipal assemblies within the Greater Accra metropolitan area. So the various steps we went through, and then we can discuss that. Okay. So we've already heard this morning about the effects of air pollution on our health. I think in Madam's earlier address, she talked about 28,000 people dying every year from air pollution related causes, which is higher than the deaths from malaria, tuberculosis, and some of the very common HIV/AIDS, some of the very common diseases that we know about. And we know, for example, that there's a malaria control program which seeks to deal specifically with malaria. There's a lot of programs to deal with HIV/AIDS and so on. But then you have air pollution, which is actually killing more people than these individual problems. And so it's actually important that we focus on it. We define air pollution as any contamination of the indoor or outdoor environment by chemical, physical, or biological agent that modifies the natural characteristics of the atmosphere. And as you see, most of the focus has been on PM 2.5, PM 10, ozone, NOx, because these are mostly the ones that pose the greatest risk to our well-being. Again, it's already been mentioned, but if we're able to deal with air pollution, we can link that to several of the SDGs. For example, good health. We all want to have good health, affordable energy, sustainable cities, okay? Responsible consumption, because some of our consumption practices also impact on air pollution and vice versa. And of course, climate change. Some of these pollutants are also climate forces. They are greenhouse gases. So you can link air pollution to the SDGs, and achieving better air quality helps us to achieve the SDGs as well. So to the main task that I want to talk about. The air quality management plan, which Madam has talked about a couple of times already today, has been developed by the Environmental Protection Authority. And that air quality management plan has various goals and tasks that it seeks to achieve. Now, how do we achieve those tasks? How do we achieve those goals? That's where we come in. So by the kind courtesy of Clean Air Fund, sometime, I think it's 2024, towards the end of 2024 into 2025, they gave funding to PSS Ebenia, which is a private institution, with the support of myself and some colleagues from UNE and other places, to work with 13 municipal assemblies within Greater Accra to develop air quality action plans. So this is basically taking the air quality management plan, what we want to achieve, and saying what are the actions we're going to actually put in place in order to achieve those goals. So just to summarize, the air quality management plan has 5 main broad goals, things it wants to achieve. One is emissions reduction, okay, leading to cleaner air. Second one is collaborative governance, so understanding the fact that it cannot be done by one institution alone. EP alone cannot do it. The universities or research institutions alone cannot do it. But you need different organizations. For example, if you're going to deal with pollution from vehicles, that will require the collaboration of the Driver and Vehicle Licensing Authority, DVLA. You also require the active participation of the Ghana Police Service, for instance, who are usually on the road enforcing some of these regulations. And then you also need effective systems and tools. So, for example, the dashboard and so on that has been created, Afri-SET, which is making sure that we have the right monitoring kits to be able to make the measurements, and then creating the necessary scientific basis for the decisions to be made. You want to go to the decision maker with the right data set, with the right information to say, this is why you need to act, okay? And then finally, enhance public awareness and knowledge. So once we have all the information, we are able to then reach out to the public and say, this is why air pollution is important, this is what you need to do, this is what all of us need to contribute. Okay, so in terms of creating this air quality action plans, I would say there are 4 key steps that we undertook. First one was to identify our stakeholders and engage in stakeholder consultations or engagement meetings. And then we did air quality assessment. And based on the air quality assessment, the assemblies then defined certain goals that they want to achieve. Okay. And then following that, we developed the air quality action plans. So stakeholder engagement and the various activities. So the first step we did was to actually go to each assembly and engage them, find out what they are currently doing about air pollution, and also then set up air quality action plan teams within the assembly. So in each assembly, we go to them and we say, let's create an air quality action plan team within this assembly. And so one assembly may have different compositions. So in some assemblies, we have queen mothers, queens, we have chiefs, we have presiding members, we have different groups of people. And this composition of the team is done by the assembly itself. The goal here is that the assembly needs to own the whole process. Because, for example, now the project has ended, we have left the scene, it is left to the assembly to implement it. And therefore, it was absolutely important that we created the necessary conditions for them to own it right from the start. So they formed the committees themselves, they selected who has to be on the committee. Of course, we provided guidance to ensure that they have the right mix of policy people, people with technical expertise and so on, and the local folks, assembly members and so on. And this team then became important because they subsequently helped in all the other processes that had to be undertaken. So we work with this AQAP team then to identify hotspots within the assembly. So we go to each assembly and the AQAP team will go with us to, for example, lorry stations, to refuse dumps, to places where they consider to be hotspots. Again, we had at the back of our mind some data that had already been collected through the Breathe Accra project. And so we knew, and of course, data sets from EPA and other places. So we knew where potential hotspots are within the city. And then we, again, worked with the AQAP teams to then select a series of sites where we did some monitoring. And then we produced, that helped to produce the assembly-specific air quality action plans. We also held national level engagement meetings, again, thinking about the need for collaboration and the fact that the assemblies will need the services of other organizations. So DVLA, EPA, the Ghana Police Service, Ghana Meteorological Agency, and several National Road Safety Commission. So many organizations were invited into a room like this for an engagement meeting at the start of the process and also towards the end. Okay, so we worked with them to set the goals at the beginning, and then we worked with them to validate what we had done at the end. Okay. So now I just want to walk you through some of the processes. So for example, here we have our pre-deployment event. So we had to send out sensors to do some air quality monitoring. But before we did that, like I said, we went to the assembly, the air quality action plan team together, then had to go to various markets, so like Medina Market, Medina Zogo Junction, Adenta Lorry Station, and so on and so forth, together with a team to basically physically visit the place, but also have conversations with the people and let them know this is what is happening. And so that's our team together with the AQAP team doing some of these exercises. That's scouting, climbing up to put up some monitors. Again, further meetings with people in the assembly. Prof. Sahis, you may notice that Abena there with her Rasta. Abena was then working with Afri-SET. So we again collaborated with Afri-SET. They helped us with calibrating some of the sensors that we had to use in the field. Again, this is in a market somewhere in Accra. More field work. So a refuse dump somewhere. This is Abigail talking to one of the municipal health officers, and that's our monitoring devices installed. So for each assembly, we selected 4 hotspots, and we made measurements of PM 2.5, PM 10, SO2, and NO2. Okay, so each assembly we had 4 measurements, 4 different pollutants at 4 different sites. Okay, and actually, although we say it's 13 assemblies, we end up with 15 because we have a curious situation where AMA is one assembly, but then it has sub-metros. So it has Ashiedu Keteke under it. Which other ones? So AMA has three sub-metros under it. So if you take those 3 plus the other 12, we have 15. So what we ended up with is 60 locations, okay, across the Gamma area, and 4 different pollutants at each of these 60 locations. And just to give you kind of how detailed we were, you'd see, for example, that we'll pick a particular location, let's say, Yarifa, and then we'll describe what is happening at the site. Okay, so together with the AQAP team, we'll describe what is happening at the site. So, for example, there's a refuse dump somewhere which has a lot of burning, and we'll take the specific coordinates and all that. These were important to understanding what's happening on the ground, but it was also important further down the line because we were going to do some modeling, and we needed to know where our receptors and our sources were. Okay, so that's just to give you an example of some of the details that we had to take. So the end result is that you have all these hotspots identified across all the 15 or 13 districts. Okay, and these are the names of the districts that were involved. So we have the 3 Ablekumas, okay, Ablekuma Central, Ablekuma North, Ablekuma West, Adenta Municipal Assembly, AMA. Okay, so AMA has Ablekuma South, Ashiedu Keteke, and Okaikwe South. And then we have Ayawaso, the 4 Ayawasos, Ayawaso Central, Ayawaso East, Ayawaso North, Ayawaso West, Kole Klote, Ladade Kotopon, Lankwantanai Madina, and then Okaikwe North. So these are the various assemblies that were involved, and these are the different hotspots that we had identified after all the visits and so on with the AQAP team. So that's looking at it from a broader perspective. If we then zoom into a specific assembly, you'd see we identified different locations, some of which already had air quality monitors. So, for example, those places in orange, okay, so those places, for example, Nima Market, okay, it's a hotspot. It's for those who are not Ghanaians, this is a very, very busy place, Nima Market. It's you've got roads, you've got various activities happening in this area. So it's it's a hotspot for lots of pollution, but it already had a sensor from the Breathe Accra project. So we mapped where there's a hotspot and where there's an existing monitor, okay, so that we don't duplicate our efforts. Okay, so that's the kind of getting the background sorted. And then once we've done that, we then went out to do some monitoring. And just to give you an idea of, like I said, we measured 4 different pollutants, PM10, PM2.5, NO2, and SO2. And there are WHO guideline values. These are basically what the WHO is saying you should try not to exceed, okay, if you want to have good breathable air. So the WHO values are here. So for example, PM2.5, it's 45 micrograms per meters cube over a 24-hour period. That's the peak, the highest value you should get. The Ghana standard at the moment, and Madam can correct me if I'm wrong, is 70 micrograms per meters cube. The reason between the differences is that these are much harder to achieve at the moment. So the WHO sets the guidelines, but each country then has to look at its own peculiar circumstances and say, we want to set medium-term goals and then long-term goals. Long-term goal is that we all want to achieve or even do better than the WHO standards. But we can't achieve that immediately, right? So we need to, as they say, you need to crawl first, and then you walk, and then you run, okay? So this is us saying maybe you want to start crawling at this level, okay? So I showed you those because then we put them on our monitoring. So when we've done the monitoring, the assemblies can then gauge where they are relative to these standards. All right. So for example, you can see that if we take the PM 2.5, and I'm not going to show you graphs from all the 60 times 4 locations. I'm only going to show you 4 graphs, but it as an illustration of what we did. You can see if we take PM 2.5 for this particular location in the Lanquantanai Madina assembly, it's exceeding the WHO guideline value. The WHO guideline value is the one in pink. I think it's pink. That line. I know this one is green, but I'm not sure whether this is. But basically, we are exceeding the WHO guideline values, but not exceeding the Ghana guideline values. Again, keep in mind, this is just a single site over a 24-hour period. Similar for PM10, okay? So you'd find that in making our graphs and so on, we made them quite simple, straight to the point, so that even a non-technical person can then understand. All right, so straight lines, have you exceeded it or not at a particular point in time? This is for NO2. Again, you can see that there's for those scientists in the room, you would see 2 peaks, which is kind of common when you look at air pollution data over a 24-hour period. Morning rush hour periods, air pollution spikes. And then in the evening, when we are all trying to rush to get back home, air pollution spikes. During the middle of the day, when everybody has gone to park their cars and stuff like that, air pollution tends to come down. There's also even a link to cooking. I think Prof. Arku will be speaking later on. They've done work that shows that you get, for example, the Wache seller, the Kenke seller, and so on. They would wake up at about 4 or 5 a.m. to make sure that the wache is ready by 6, 7 so that we can all go and enjoy it. And so all of that sometimes contributes. It's not just traffic, okay? All of that contributes to morning spikes and then evening spikes. And then during the day, things tend to calm down a bit. So again, this is important for the assembly because then they know what time of day to target, right? They know what time of day to target, they know what time of year to target, and so on, if you have longer time series of data. Similar results for our SO2. So based on that, we summarize for each assembly what the highest levels are, what the low levels are, where the most polluted parts of the assembly, and so on. All of that data was then provided to the assembly. Okay, so for example, we can see that in all out of the 10 assemblies, we had high levels of NO2, SO2 across all of them. And values of NO2 could reach as high as 226 micrograms per meters cube. If you remember the standards I showed you, these are several times higher than some of the values that we showed. And elevated concentrations were in dense commercial areas such as markets, transport stations, and schools. That shouldn't be too surprising to many of us. Who can guess the average age of a car in Ghana on our roads? 20 years? Okay. Any other number? No, it's not 40. It's about 15 years. It's about 15 years. That's because most of the time we wait the car when it's a, there's a penalty when you buy a car that's more than 10 years old. So we wait when it's about 8 years or thereabout. That's why now you see a lot of Toyota Voxy. Toyota Voxys are just getting to that 10-year period. So it's now cheap enough for people to buy them. Okay. So if you've realized, cars tend to come in certain batches. Okay. Cars tend to come into Ghana in certain batches. That's because of people import them just in time to beat that 10-year penalty. Okay. So most of the cars in Ghana, so the car will come in, when it comes here new, it's 9-8 years old, and then you obviously wouldn't use it for 2 years and throw it away. You use it for a couple of years. So our new cars are mostly around 10-12 years. So the average age of a car on our streets is about 15 years old. Okay. And that means that at our lorry station, I'm sure that's if you take the whole of all the cars. But if you went to the lorry stations, I'm sure the 40 years will be getting close to the 40 years. If you go to Circle or Otu-Larbi, okay. So again, those of you who are not Ghanaians, please take Otu-Larbi is where all our entertainment is, okay. But you will find cars which are older than anybody in this room. In some of these places. So all of that, okay, there's no catalytic converter on those vehicles. So our transport yards and so on tend to be quite polluted. All right. So no surprises here at all. So the assemblies know the levels of pollution, they know the hotspots, and now we then guide them to produce their air quality action plans. And this is, again, following from the air quality management plan, which Madam Selina has talked about. And from that air quality management plan, they are supposed to establish and implement measures to reduce pollution. We talked about this. Prevent dust emissions, promote cleaner fuels and efficient cooking, and encourage tree planting activities. Enforce their bylaws, okay? So people should not be burning refuse anywhere in random places. Raise awareness, open burning, deal with open burning, provide effective waste management systems, and then consider environmental factors during planning committee meetings and so on. So we go to the assemblies and we help them to set specific goals. So you know that your SO2 levels are this high around this particular location. Okay, and we talked about the sources of these pollutants. So what are you going to do about it? All right. And so, for example, you'd have an assembly saying that they will ensure that 50% of inhabitants are informed about air quality issues by a certain date. So if you look at what we are trying to do here, we are trying to be smart, specific, measurable, what's the A? Achievable, realistic, and time. I think the last T, the T is time, right? So we guided them to set these objectives or goals in a smart manner, so that it's easy for them to go back to it in 5 years' time, and actually it's not just 5 years. As you will see, there's activity for each year, what they are going to do each year, so they can benchmark their progress against what they themselves have set. All right. So this is kind of a spreadsheet that each assembly then produced. So you see, for instance, that in terms of their objective, action 1.2, educate the public and private basic schools, and they are going to do this in years 1, 2, 3, 4, and 5. What's the source of funding for this? IGF and donor funding. Okay, so, and who is responsible? Okay, by responsible we mean both the assembly but also partners that they are going to work with. So you'd see that this is the environmental health unit and so on, different directorates that they have listed. So it's quite specific as to who is going to do what and when they are going to do it. Similar things for different, so for example, enforcement and so on, different activities, who is responsible and so on over the next 5 years. So that's what they have planned to do, and this was partly informed by some modeling that we did. So we asked them to set these goals, and then we put that through a model, model, and we say, if you are able to implement these measures, okay, so we have what we call a best case scenario. If you are able to implement all these measures, what's the best case scenario that we're going to get? What's the business as usual? If you don't do anything, what's going to happen? And what's the worst case scenario where emissions actually continue to increase? So you can see that in the best case scenario, they reduce their emissions, which is if they implement those activities they've said they will implement. In the business as usual scenario, their emissions stay high. And then in the worst case scenario, emissions go up. Okay. So we did this for different pollutants for all the assemblies. And for the gamma area as a whole. This is showing you for the gamma area as a whole. Okay, so then what happens next? Because what's the point of preparing these action plans if they don't implement them? Like we said, there is a time-bound specific objectives that they are supposed to achieve. So they've got various plans. For example, setting up school clubs. Okay. And some of the assemblies have already started doing this. I'm sure Mr. Desmond will attest to the fact that, for example, Ayawaso North Municipal Assembly have already started going to schools, churches, mosques in their assembly and already sensitizing them about air pollution and what they can do about it and so on. So some of this is already being implemented. They are developing their communication strategy around this. And there are also other projects ongoing that will eventually tie into this. So there's, I know Clean Air Fund has a specific project on communication and awareness creation. They also have a project with the assemblies to develop and gazette their bylaws, which will then give them the legal effect to take action against polluters and so on. And introducing spot fines and improving waste management. All of these are different things that they are doing. and then also to ensure that they keep up with the monitoring and so on, procuring air quality sensors, establishing regular feedback systems, and then doing monitoring and evaluation. So I'm going to end with this image. The ultimate aim, okay, is to actually reduce air pollution by targeting the sources. So say, for example, I visited you, okay, I came to you at home and I said, and you asked me, what will I drink, okay? And I said coffee, all right? So you went into your kitchen and you brought me this cup of coffee. Now, by all standards, it's a really nice cup of coffee. The only problem is I then tell you, well, I actually don't drink milk. But we already have some milk in here, okay? And let's assume the coffee you used was the last bit of coffee in the house. So you can decide, for instance, that you're going to take out the milk and get me coffee without milk. Now, we all agree that's a very difficult process, right? To get the milk out of the coffee after you've put the milk in the coffee. The best thing to do is to not have the milk in the coffee at all, and then bring me my black coffee. So when it comes to air pollution, the best solution is to not have that milk in our coffee, is to not have the pollutant in the air in the first place, all right? Any other measure you take is like trying to take some of the milk out of that coffee. You may be able to use some processes to extract some of the milk, but we can all agree you will never actually get all the milk out of our coffee. We will never really get back to black no sugar, okay? And so our goal really is that we want to target the source. We don't want to put. We've already put some milk in there. Let's stop adding more milk, okay? The sensible thing to do is that we stop adding more milk and then try to take some of the milk out. That's the image I wanted to leave you with. Thank you.
If anyone has any questions for him, if I may start, I want to find out if you placed some of your monitors in some of the schools, because you talked about education. And what were some of your findings in these schools?
Yes, so for example, Kanda cluster of schools, we did monitoring in Kanda. And what we found, for example, was that for example, when the children go out to play, that's when you see a lot of pollution levels going up, particularly the PM 2.5 and PM 10. So during playtime, that's because the park is almost bare, which again that again helps the assembly because they can see the effect or the impact that will be made if they put green grass on the field or they were to use AstroTurf, okay? Because you cannot stop the children from playing. Children should play. We all played football at some point when we were kids. And so it's some of that. We did monitoring in schools, at hospitals. So Mamobi Government Hospital, Nima Market, for instance. We did Circle, Interchange, various places. So different groups. We did secondary schools, we did, and so on. Primary schools. Accra Girls, which is on the George Walker Bush Highway. We did monitoring there. We did monitoring at the University of Ghana Medical Center. Okay, so we again, this was informed by the assembly. So each assembly, but of course we gave them a bit of a nudge. All right, you let them choose, but you are guiding them to choose based on your technical expertise of the sensitive receptors.
Thank you, Doc. I'm Awini Sule from Kintampo Health Research Center. I wanted to find out what type of monitors were used, and during your deployment, were there any challenges that you come across, and how those were sorted out?
Okay, so we use the Aircore S500 sensors because we wanted to get continuous reading. Okay, so we're reading this the data we actually aggregated over every 30 minutes. So we had an S500 Aircore sensor. Challenges. The initial stages, we had issues with power. So the sensors come with batteries, which is supposed to run for some time. And then we bought power banks, right? And then we went to the field and realized that our power banks were not strong enough to charge the because we had wanted to set these up away from without needing electricity. Okay, so eventually we had to change and then so wherever we went, we got electricity from a nearby source and use very long extension leads and so on. So that was an initial problem. I think we now have enough power banks to set up a power bank shop because we couldn't utilize them effectively. So that was a lesson we learned. But in terms of the site itself, because we were working with the assemblies, they provided us with people who ensured safety of the equipment. And relatively, people were, once we explained to people, they were quite receptive of the idea, and therefore we didn't have a lot of challenges mounting these monitors around. So yeah, we didn't have theft issues or any of that. Definitely. We actually discussed that with Afri-SET at some point, but then Clean Air Fund gave us 1 year to finish. If we don't finish earlier and they take their money back, so we had to make adjustments. But of course, that's definitely something, because we know that Afri-SET has designed a standalone power system which uses solar and so on, which could power this, but we simply didn't have enough time to build enough of them to go around doing the monitoring.
Hi, good afternoon.
Yes.
I'm George, working with Keba Africa. We are also implementing a Clean Air Fund, a monitoring vehicular air pollutants. So I have two questions. So which of the hotspots contributed most to the high level of pollutants that you observed? Were they from hotspots that are vehicular heavy hotspots or from the waste burning site? Then the second question is on the sensors used. Do you use multiple sensors measuring the 4 pollutants or just one sensor measuring all of them?
Okay.
Thank you.
So I'll start from the second question. We had, so for each of the sites, for PM10 and PM2.5, we could monitor it with the same one sensor. So for each of the 4 locations within, and we were doing them simultaneously. So for each of the 4 locations within an assembly, we had 3 sensors. There was a sensor for SO2, a sensor for NO2, and then one sensor which was doing PM10 and PM2.5 at the same time. So 3 times 4 is 12. So there were 12 sensors working simultaneously within each assembly at the same time. The second question had to do with the hotspot. I would say that it depends. It depends. So, for example, if you go to La Mamli, right, there were places where kenke, the production of kenke, right, was a major problem. And then in some assemblies, you would have, for example, Medina Zongo Junction, because you have all this pollution coming from, so you have the VRA lorry station having quite a lot of pollutants. So it depends on the assembly. For example, Circle is so busy with, and interestingly, the Circle sits between, I think, 3 different assemblies. It sits, I think, part of it sits in Ladade Kotopon. Part of it sits in Ayawaso Central. And then I think part of it sits in a different. So you've got quite a polluted area with so many. So it depends on which assembly you're dealing with. In some places, biomass burning, waste burning is a big problem. Some places it's transportation. Are you going to save me? I think there's one more hand. Okay.
There's a question online, so I want you to. This is from Oluwatosin Kuti.
Okay.
He says, please, the name of the modeling tool to assess the effects of the policy options.
It's AirMod. AirMod model. AERMOD. AirMod. It's proprietary software, so you have to pay for it. Luckily, Clean Air Fund could give us enough money to pay for it. I think it cost about $2,000 to get it. Yeah, I think that will only run on Linux or something like that. And yeah, so there's you can try building it on Linux for free, or you can buy the proprietary one, which helps you to set up your meteorological data sets and all that.
Thank you very much, Dr. Larbi, for that splendid presentation. Yes, just 2 questions. One is going to be, you didn't speak about your internet connectivity, and I think that is very important. I just wanted to understand, because we face similar issues like that in Liberia, how continuous your data reporting was.
Yeah.
And we understand how the internet issue is up and down, and how effectiveness counts, especially with the reporting of these sensors, because they are of varying companies or suppliers. Another thing is was the power supply. I mean, very beautiful presentation, but it's going to be quite more intriguing to me because of your relationship with the Clean Air Fund and the University of Ghana Afri-SET, to see what happened during the dry season versus the internet connectivity and the power supply consistency or intimacy or something like that versus the rainy season. I was going to be a lot more interested in that, to see the variation, and also for future works before using the sensors to ensure that, to promote the good work that you all do in Ghana, and to have it sent to Afri-SET for validation, which is very important, and that will, I hope, erase some of those challenges that you foresaw in the long term, because hopefully the 6 weeks they talk about during the dry season and the rainy season will eliminate some of those issues that you face, both for the connectivity issue or also the relating to power supplies and things like that.
Okay.
Thank you. Okay.
Yeah. So in terms of internet, we were not actually reporting the data live. So the sensors we used have the capacity to actually store several months worth of data at that time resolution. So we would go to a site, do the monitoring, and then we would store the data, which we've shared. We've shared with CAF, and it's available, I believe, for other people to use. So we didn't have internet challenges because we were not doing a live reporting of the data sets. again, in terms of the dry versus wet season, definitely in Ghana, there's a very sharp contrast between air pollution in the dry season when you have the harmattan. In my previous life, I was a meteorologist. I was a weather forecaster. So I know what happens during the dry season when you have all this harmattan-laden dry dust coming all the way from the Sahara through Niger, northern Ghana, all the way to the south. Pollution levels spike. And then during the wet season, obviously you have a lot of wet deposition. So even the pollutants in the air. For example, yesterday we had very torrential rainfall. If we were to go out there this morning to do monitoring, the air would be much, much cleaner than it was before the rainfall. Okay. So that sharp contrast is that our monitoring didn't, again, it was 1 year project. So the monitoring didn't cover the entire year for us to see that contrast. But we are aware, like I said, we had prior data. There's a Breathe Accra project which has collected a lot of data. And I've seen presentations by Madame Selina where she's shown, how do they call it, with dates, okay? Like a calendar plot where you see the differences in air pollution depending on the time of year and so on. So yeah, okay.
Okay, thank you very much. Let's give him a round of applause. I think this is a very practical research that comes so close to us. We are changing the program a little because the next session is going to be virtual and they are waiting and the time difference. So break right now and go for lunch. 45 minutes, we come exactly 1:30. We have to start the next session, which is online, virtual. Thank you. Those online, welcome back from lunch. Our next presentation is going to be by Professor Raphael Arku from the University of Massachusetts, USA. And he's going to do a presentation on health impacts of air pollution.
All right. Okay, thank you for Dr. Hughes and everybody out there for having me. And good afternoon to all of you. It's early morning here, so we haven't had lunch yet. Having asked to talk about health impact of air pollution, and as you know, this is a very broad topic. So I have put together a set of slides to make it a little bit engaging and then give you the broader background. And then a little bit later on, I'll provide some Ghana specific work. There is no way I'm going to exhaust all of these, so I'm just going to touch on some of the evidence as they exist currently across the globe, and then end up with some work that we're doing in Accra to show you some of the evidence based on health impact of air pollution. All right. Yeah, so broadly, I wasn't part of the morning section. So if there are a couple overlaps here and there, just forgive me. I would like to start briefly. Usually this is what I do. I want people to be on the same page because when we hear of air pollution, you don't know exactly what comes to people's mind. Some people think of it like stench, something smelly. Some people think of it like just the dust particle or the smoke they see. But beyond those that you see physically, there is all these other things going on. So broadly, the air we breathe is consisted of a bunch of things. You can think of it like you having a stew of a bunch of chemicals, right? Including gases. Some of them are organic species like metals, elemental carbons, and so on and so forth. So whenever you hear of air pollution, just be mindful that it's not just the smoke you see. Within those has so many things that some of them we don't even attempt to measure them. So just this picture here give you a bigger overview that when we talk about air pollution, we are talking about a lot of things that are clustered together that's making the air unclean, and for that matter, making it unhealthy for us. And some of the things that determine these differences in terms of the content of the air or the quality of the air include the various sources as well. And each source is unique, and depending on the source of the emission actually impacts the chemistry or the composition of the air. So the air quality can vary in terms of the composition and the size fraction based on the source that is emitting it. You know, for example, in Ghana during the harmattan, there's going to be a lot of dust particle versus maybe non-harmattan, where there may be more localized emission from maybe vehicle emissions or from biomass burning or from trash burning. So the source also makes a lot of difference in what actually constitutes the component of the air pollutant or the quality of the air. And the last thing I want to say as a way of introduction to this is that when we talk about air pollution, we care about three components or three aspects of it that I'd like everybody, if you haven't captured that already, I'd like you to keep that in mind as we go through these. So anytime we talk about the health impact or why air pollution is important, you must be thinking about three aspects. And this is a very regular thing I show most of the time in most of my teaching. The first part you can think of is the component, which I mentioned previously. The reason the component is important because it is the part that determines the type of chemical reaction that will happen after you have inhaled or you are exposed to air pollutant, right? So the chemistry, whether it's water soluble or non-soluble, it will determine exactly how your body reacts to it, right? Some of them get absorb in the upper respiratory tract infections. Some of them don't. They make it all the way to your lungs. So all of them depend on the component of the air pollutant that you are exposed to. Then the next important is the size, which many of us are used to the size because we do talk about maybe PM 2.5, PM 10, ultrafine. Several local sensors are mostly doing PM. So most people, when it comes to air pollution, are quite familiar with the size. But one thing they don't realize, why does it matter, is because the size actually determines the region of the lungs where, when you inhale them, where they get deposited. So whether they get trapped in the upper respiratory tract or they make it to the alveoli, which is where the air exchange takes place between the lungs and then the blood, it determines by the size, you know. So if it's very, very fine, they are likely to make it deep down into the lungs. And then finally, we also hear about the concentration, which is the amount or the quantity of that air pollutant in the air. And that is also critical because that is the part that determines the magnitude or the actual size of the effect, you know, and then the biological response. To go into the health effects, but the reason why I'm invited today is to give you a little bit of background. Let me start with some historical aspect of this. And anybody who takes any air pollution course or workshop, you should probably familiarize yourself with some of these major historical evidence that we had that drew attention of the world that something is not right about the air that we breathe. There were prior history from the days of Aristotle down to before the most recent one. But in the recent century, there were three major events that drew the global attention to how bad the air can be. One of them happened in Belgium in the 1930s. And you can see the lower part of, let me take the laser on. Yeah, the lower part here, it's like a valley, it's a mill town, a lot of factories, emission, a lot of air pollutant to the atmosphere. And then over a period of time, when the disaster happened, there was no dilution because of atmospheric conditions, something like we call it temperature inversion. So during that period, a lot of people died within a very, very short period of time. So it was like, what's going on here? Why are people just falling dead as a result of bad air quality? And then from there, it came to the US. There was another event in 1948 in Pennsylvania, in East Coast, not too far from where I am in Massachusetts, about two states down. And the town where it happened is called Donora. And the date is also there, early fall, and about 6,000 people fell ill and 20 of them died, some of them even including animals. That was figured out that they all died as a result of the bad air quality. And this happened within few days. If you see here from 25th of October to 31st, just within a week, there was a bad episode of air pollution, again, something to do with the change in dilution factors that happen in the atmosphere. And then the most famous one happened shortly after that in the UK, London, England in 1952, that most people are familiar with. And during the 1952 situation, at the time, we were able to have actually real evidence of quantitatively measuring air pollutants and then also documenting the number of deaths that were happening at that point. As you can see from the images and then the figures here, the red here is showing the total number of deaths that were occurring in that fall. Again, it happened in December, beginning of the winter. It has something to do with too much emissions and then temperature inversion that the air pollutant usually doesn't dilute as expected. Usually people think that when you emit them high and they get diluted, that's the end. But we have this episode here where you see the death tracking carefully with the amount of smoke that was measured in milligram per cubic meter. And during that time, the mortality rate, if you look at it on a more time series note, that it tracked carefully with the measurement of sulfur dioxide, which was as a result of burning of coal from industrial revolution that was happening in all of the factories across England and most part of the European continent at the time. And during that period, it was estimated that close to 3,000 to 4,000 excess deaths, right? This is the background. People were dying, daily around 3,000, but there was this extra peak that happened during the episode period is what we're talking about. And overall, by the end of it, you notice that the deaths did not come down after, even though the air pollution went back to the original level. So it was estimated that between 10 and 12,000 people die overall because of this one episode. So it began to draw the attention that, it's not just the air, that the air is bad, it actually has a real implication for people's lives. And then most recently, most of the epidemiologic evidence that has come around started with a time series. People have looked at daily mortality from short-term exposures, and either mortality or hospital admissions or any outcome that they have looked at looking at short-term exposures. We found out that there are direct consequences for something like all-cause mortality, cardiovascular disease, disease of the heart, and then disease of the lungs, which is respiratory mortality. And then evidence is so strong. There were also additional longitudinal studies where you have like a cohort, you follow the people, and it's much stronger than time series. But all of the evidence also supported what we know from time series that, short-term exposure, day-to-day variation in air pollution has direct implication for death, for illness, for either illness of the heart or for the lungs. And then also there are experimental evidence using animal models in the lab or human experiments that have been shown that to tell us about why, when you get exposed to air pollution, it causes all of this disease. So the evidence is very strong. There is no way at this point anybody disputing that air pollution has a major health consequences. So one other one that I would like to begin to draw attention to specifically, if you are not convinced yet, will be to start talking about some of the examples that are existing currently. If you look at this map here, this is an old life expectancy of the United States. And it should amaze you that a very rich country like the US, we have a huge disparity in life expectancy of about 20 years. So if you live in some of the worst off areas, your expected life, the statistical projections of how long we expect you to live can be as little as maybe 65 through 70. And then if you are living in some of the the best of areas, you can go to, as much as 80 years or close to 90 years. And it also differs by gender, whether you are male or female. So one of the questions is, for how long people live or are expected to live, does air pollution actually impact that? Because think about it. If there is evidence that it influences mortality, then if the air quality is clean, then life expectancy should improve. So a group of people went for colleagues of ours, several of them from Harvard University and some of the teams from there and other institutions in the US. They came around and conducted an interesting study looking at life expectancy. Here, what they have done is, if you see, basically, they want to assess whether improvement in air quality actually has direct implication for improvement in life expectancy. So what they did is all of these 200 and several metropolitan areas across the US, and you can agree with me that the data is coming from all across every part of the US. So this is clearly generalizable to every aspect of the US, or geography of the US. And what they did is very simple. In the early 70s, US EPA established the Clean Air Act, where from that time on, it became law that we have to monitor air pollution across the US. So what they did was, in those early days, we began to invest a lot of money in monitoring and then also in cleaning up the air. So they were asking a very simple question. We want to look at the relationship between life expectancy during the early days when air pollution was high, and then we want to look at that relationship again after 20 years when air pollution levels went down. And the figure here shows the first part of the year analysis in the early 70s to early 80s, so late 70s to early 80s. And then you can see air pollution went all the way for PM up to about 30 microgram per meter cube here. And the life expectancy is plotted on the y-axis here. And overall, across all of these metropolitan areas, you will see this inverse relationship. In other words, increasing air pollution is associated with decreasing or reduced life expectancy in the early days. Now, after about 20 years, they conducted the same study from the same locations again. And then you can see now that clearly air pollution has been reduced here by way over 10 microgram per meter cube. But even after that reduction, you see again that there is this inverse relationship, that still there is that reduction in or lower life expectancy being associated with increasing air pollution. And now they did an interesting analysis again. They take each of these time points for the same city or the same metropolitan area and subtract them and conduct what we call the difference analysis. And after all of those were done, you will see an inverse. You see a positive association now where the amount of reduction in air pollution over that period seems to be now associated with increasing life expectancy, right? So overall, it can range from, on average, about 7 months to about 3 years in total. So this brought a very real evidence that indeed, if we clean up the air, people's life or quality of life improves overall. So one other question is, who are the people most affected, right? When people are dying, we talk about life expectancy, we talk about mortality, we talk about respiratory health. Who are the people most affected? In fact, this is another interesting thing that we need to think about, that even though air pollution affects everybody, there are certain segments of the population that are most impacted than others. And mostly, we're going to see from the evidence that children are mostly impacted or are more impacted, and then those who are older are more impacted than the the adult age group. However, every one of us is really impacted by the air because we all do the same basic mechanism by breathing in, breathing out every day. So if you look at across the life course, depending on what the stage of life you are in, the evidence is strong for specific type of impact on your health. During pregnancy or that process when, let's say, a mother is pregnant, a woman is pregnant, there are evidence of preterm birth, low birth weight, and some other birth outcomes, even in some cases, including maternal mortality, associated with air pollution at that stage. The children that are born as infants at that moment, because of the physiological conditions, you could be born with low birth weight because you are exposed in utero. You could be born with low birth weight. And when you are born with low birth weight, it predisposes you for other things later in life. You could have a smaller lungs. So if your lung is not properly developed and is not reaching the peak, you are also predisposed to having some respiratory infections or respiratory disease in the older age, including something like COPD that has been linked to low birth weight and then smaller lung development in early life. And then, young children, we know this is very common. Everybody knows about this, that you have all these acute respiratory infections that goes on in school-age children all over everywhere in Accra and all over the world. And then you get older, then it turns slowly into chronic diseases, hypertension, diabetes, cardiovascular disease, and then eventually it can lead to premature death, right? So you can see that across every stage of life, there are specific or more pronounced vulnerability associated with exposure to air pollution. When you put all of them together, you see something that looks like this, that the distribution of the impact of air pollution across the life course seems to increase in early life and then goes down a little bit in young adults and then begin to increase cumulatively as you age, right? So you can put yourself here, whatever age you are. Where do you belong? Are you in the middle age? You are somewhere here. If you're getting older, maybe to 60 and above, 70, cumulatively, the risk increases for you of the impact. Children, very, very young, infants, and until getting to school age, they also have some of the high impact. So you see this kind of like some type of U-shape happening when it comes to the overall cumulative distribution of the impact or the vulnerability of air pollution across the life course. I'm showing you the same thing again from other evidence. Hello? Yeah. All right. Showing the same thing quickly, just the same thing I said before, looking at respiratory infections is more among children, and then cardiovascular is more among the older folks. Let me quickly skip a few other evidence, like people who are sick. A study was done in London. We saw the same thing, that even going 2 hours out to a very polluted area can actually worsen your health condition. But let me go down quickly to a place like Ghana to wrap up because of time. What do we see? Do we see any of this in our own country, right? We're talking about all these global events. How about Ghana? A lot of work is going on across the country and in many African countries. I cannot go through all of them. Colleagues working in Kintampo doing a great job. But let me just give you some ideas from Accra. This is a map of Ghana, and we put together we model air pollution like PM and NO2, and then we begin to do some work in schools. We went to several schools, like 100 schools in Accra. We measured a bunch of things, including lung function, sleep, blood pressure, cognitive and behavioral issues among the school children, about 1,000 of them. And quickly, when we link them up, their home location and school location to air pollution, we begin to find some interesting results. I'll show you just one of them among the schools is behavioral problem, right? Whether kids are internalizing or externalizing their behaviors, being aggressive or having something to do with potential anxiety or depression. There is evidence in our study that among school children in Accra, air pollution associated with behavioral problems. We also did a birth cohort study recently. We follow about 3,000 women across 30 health facilities, and we did the same analysis looking at birth weight, low birth weight, and then preterm birth. And just to show you quickly here, the result is still staggering. We are seeing a strong association of air pollution with preterm birth. We are seeing the same thing with term birth weight and also with low birth weight. So evidence is all over, and we cannot hide away from this at this point. And I'm sure all of you there, I'm only preaching to the choir, but even within Ghana and within Accra, we see that there's a lot going on. This is my last slide, just to say, but all of these things, how do they come about, right? Whether you have a respiratory infections or it's a cardiovascular, mental health related behavioral issues, how do they come about? All of this occur, but biologically, we understand that the mechanism include issues like how some of the inhaled pollutant can make it to the brain and then result in neurobehavioral outcomes. If you have them in your lungs, there's an inflammation there that leads to some of these airway diseases. Sometimes you inhale them, they stay in the lung, they spill over to the blood, and in the circulatory system, they result in all of these processes. And then in the end, you can have something like heart attack, or you can have a dysfunction in your heart rate and things like that. So evidence is so strong, and I think anybody and all of you out there might just acknowledge that we cannot escape at this point. And across the globe, everybody breathes the air. So if you all breathe the air, even if the evidence is so small, if you roll that impact or the effects across billions of people, it's a huge public health problem. I'd like to stop here and thank you, and then maybe take a couple questions before we wrap up. Thank you.
Thank you, Dr. Raphael. We have time for 3 questions, just 3. So anyone who is ready to ask. No questions? Okay. A hand.
Thank you very much, Dr. Raphael. My name is Traore Alassane. I'm from Senegal. And I was wondering about the time series you have focused during your presentation between 1972 to 2000. Why this period? Why do you make a choice for this period? Due to the situation in United States, or there is another, let's say, reason to make a choice for this period? And my second question is about the parameters you have select by doing this study at the school. Why you focus on NO2 and NO, because we know the sources of this pollutant, and do you try to see where this pollutant come from and reach this school? Thank you very much.
Sure. Thank you. If I understood your question, your first one was talking about the life expectancy study in the US, and then you were asking why we chose those 2 time period in the early 70s and then, late 70s and early 80s, and then early 2000. Is that correct? Okay, I see your hand up. Somebody give me thumbs up. That's I think Dr. Nkrumah. Yeah. So I think I mentioned briefly that in the early 70s, the Reagan administration established the US EPA by law, by Congress. So the Clean Air Act was born by US Act of Congress mandating EPA to monitor air pollution. So from then, we've been spending billions of dollars to clean up the air. And I think obviously something like climate change today, you understand there are people who believe it, some people who don't believe it. And then, so this study was intended to ask a simple question. We have cleaned up the air up to a certain point in those days that we have regular measurement, and then we are putting regulatory policies in place. So, and then we have the data. Can we demonstrate that the investment that we are making in cleaning the air is producing some evidence of improvement in the quality of life? And then the second section was, there was also a break. Right now, we know that is happening in the US about funding. During that period too, there was a period where measurements stopped again, but then it came back up again after another government came and invested in it. So you have these two distinct time periods with a real evidence of reduction in both air pollution, and then you can compare the 2 time points. So I think it was just a smart idea to demonstrate that, look, you have this distinct 20 years of investment in cleaning up the air. Do we have any evidence to say that the money we are spending is worth it? And I think that evidence goes to show that even a place like Ghana or Sierra Leone or Senegal, if we do invest in cleaning up the air, it's not just the money being wasted. We are overall improving life expectancy of the people. Now, think about it. Even if it's just 1 year improvement, and if you take Ghana, there is about 35 million of us. And if everybody can live additional 1 year in a healthy life, can you imagine the implication that will have for maybe the economy and all of that? So those was the reason. And in interest of time, I'll stop on that. A quick one on the schools. Yes, we did actually completed recently what we call source apportionment and then the chemical analysis of those air pollutants. And then even for my birth weight study, we have just looked at specific source constituent, right? Whether it's coming from traffic emissions or it's coming from cluster dust or it's coming from biomass emissions. We are seeing the same evidence as the PM and NO2 that they are all associated with the health outcome. So we have the evidence now, and slowly across Africa, data is coming. So there's going to be a lot more evidence locally being produced, and we begin to see those in Accra as well. Thank you very much.
Any more questions? Okay, thank you very much, Dr. Raphael.
Thank you, everybody. Thank you, Dr. Hughes. Take care.
We'll now invite Professor Dan Westervelt, Columbia University, Lemon Doherty Earth Observatory in the US. And he's going to give us a presentation on Introduction to Air Quality Sensors, Sampling Techniques, and Methodologies. Professor Westervelt, are you online?
I am. Can you hear me?
Yes.
Okay. Thank you.
Thank you very much.
How much time do I have? 30 minutes?
Yes.
Okay.
20 minutes for presentation, 10 minutes for Q&A.
Okay, good. I will go ahead and get started then. Let me share my screen really quick. Bear with me just for a second here. So while I'm doing that, I'll just introduce myself again. So I'm Dan Westervelt. I'm a professor at Columbia University. I've been working with Afri-SET since it's existed. In particular, we were co-producing previous iterations of this workshop. And Dr. Allison Hughes asked me to speak today about air quality sensor sampling techniques and methodologies. So that's what we will dive right into. So just a little background, air quality data is very sparse globally. This is a map of the density of the number of sensors per million people. And so if it's a gray color, that means that there's no air quality data. If there's red, it means that there's less than one sensor per million people in a given country. And then you can see the yellow and the green are for higher amounts of air quality monitoring in a country. So this is from 2022, so it's a few years old, but so the picture may be a little bit better today, but not quite. Air sensors are a good opportunity for closing this air pollution data gap. So the previous plot that I showed you was actually just for high quality, reference monitors or research grade monitors. Here's a similar map, but for a specific vendor of low-cost sensors. And you can see that even though there's better coverage almost everywhere in the world, there's still a huge empty space over most of the African continent. And I wanted to, before we go into the basics of air sensors and how they work and what they are, I wanted to first just mention over the last several years, Ghana has become a bit of a relatively well-monitored case study. There's people like me that are doing a lot of air monitoring there, but then there's also other groups such as the Breathe Cities Project, which has a large network in Accra. There's been some other folks as well. Dr. Arku, who you heard from earlier, also is involved in air quality monitoring in Ghana. But through a few different projects, my team has put together somewhere around 100 PM 2.5 ground monitors in Ghana, and those are some of the. It's a mixture of different sensors. You can see them at the bottom. And then on the right, you can see the locations and the number of sensors by population. So the sensors are located mostly in high populated areas, with the exception of Kintampo, where we have a lot of sensors in rural communities in the Bono East region. So one thing that we wanted to do with this data is, could we also leverage satellite data in order to generate high resolution, high quality satellite derived PM 2.5 data sets in Ghana? Given that Ghana is a relatively well monitored African country for surface air quality. And the reason that we use satellite data as well is because satellite data is more ubiquitous in terms of its spatial coverage. So you have pretty much a daily measurement from satellite over every square kilometer of Africa, and that includes Ghana. So in cases where we cannot put sensors on every street corner, in every place, in every neighborhood, satellite data are a good option, especially when they can be paired and validated against available surface monitoring. So we did that in Ghana. And so you can see sort of on the left here is sort of a cartoon example. You have a ground monitoring network throughout Ghana. Then you have satellite data, measurements of PM, not of PM, but of things that are related to PM 2.5. You can put that together and get a high resolution data set going back to the beginning of the satellite record, so the early 2000s, all the way to present day for Ghana. And all this data is available on our website. So I'm just going to very briefly go to our website. It's called grasp.ldeo.columbia.edu. I'm sure these slides will be shared with attendees if you want to look at this later. But just a really quick demo. If you go to our website, you should be seeing our website now. Please hold a second here while we load the data. This data is all open access, so you don't need to pay anything. You don't need to even log in. It's just freely available. You can go here and you can select the date going all the way back to 2005 and all the way forward to 2025, basically. And we can just pick a specific day here. Whoops, apparently we're only through 2024. Let me try 2024 instead. Interesting. Let's go back to where I was in March of 2023 or of 2005 here. Yeah, just as an example. Okay. So you can go into this website and you can zoom into the location that you are looking for and click and see what your PM 2.5 concentration is for that day. So here I'm sort of clicking in various spots here and you can see a different value pops up. In this particular time period, there was a lot of pollution in the northern part, you can see here. So if we were to zoom in on the northern part of Ghana, you can see higher concentrations. So this data, as I mentioned, publicly available. You can go on our website, you can download it, you can select your date. We have the location-specific PM 2.5. We also have the trends. And then if you want to download the spatial maps as well, there's instructions for how to do that. So I just wanted to demo that really quick before I get back into the main topic today, which is going to be the low-cost sensors and how they work. So some of those sensors that anchor our ground-based that anchor the ground-based monitoring network and that anchor the satellite data that I was just showing are here on the screen. And so these are commonly used air monitoring systems that on the top there are what are typically in the US considered and sometimes called low-cost sensors. But I think we're realizing that A, it's not low cost for everybody, and B, even when you do buy these things, there is cost associated with running them and analyzing the data and maintaining them. And so the term low cost is maybe not all that great. But this is a kind of an example of the different types. So the one in the middle here, the Clarity Network, is the one that's used in Breathe Accra. With Ghana EPA, we have a network of modular PMs. Air Gradient has some sensors in the country, I believe. Afri-SET in general has worked with all of these, so they know kind of what we're talking about. And then the reference monitors are things like what are shown here at the bottom. The sticker price for one of these is around $20,000 US. But then there's more cost that is associated with that. So these low-cost sensors being orders of magnitude cheaper than the reference monitors are a possible alternative in terms of getting high-quality data at a cheaper price and being able to democratize air quality data and able to make it so that we have coverage everywhere or in more places than we would if we only used the research-grade monitors. So one of the challenges with doing this, of course, is how good is the data? So if these, quote unquote, low cost sensors, they are partially the reason that they're so cheap is because the technology that they're using is sort of less robust, less accurate than the research grade monitors. So we want to understand a little bit about how these low cost sensors are really working. And pretty much every low-cost sensor or every air sensor that you can buy, whether it's from a company in Africa or in the US or in Europe, they're probably using one of these two technologies. The top is basically what is referred to as a nephelometer. And so a nephelometer basically just measures the light attenuation of particles as an ensemble. So there's a detector that basically says, okay, some of this light is not getting through my airstream here, and that's because there's particles in the way, and we can use that amount of attenuated light to convert into the concentration of particles. So it's a very indirect methodology. You're not actually weighing the particles, you're not collecting them on a filter or anything like that. And it's also a very imperfect nephelometer. It doesn't have full sort of vision of all of the sizes or of all the types of the particles. So it's very much an approximation. It's only useful for size ranges from about 300 nanometers to 1 micron. So this covers most of PM 2.5, but not all of it. On the other end of the spectrum, you have what are typically called optical particle counters. And this is measuring individual particles, or at least better than the nephelometers can, taking advantage of some better sensor geometry and some well-placed elliptical mirrors and some other technology in order to provide an accurate sizing of the particles, especially in the coarser sizes. So these ones at the bottom are good for sizing individual particles, but also for giving you larger sizes above 1 micron. So just to show you the data of this, on the left-hand side of this plot, we have a system where we've basically injected, I shouldn't say we, the authors of this paper, I got this slide from Just Schreiner, but the authors of this paper injected particles that had a median diameter of about 0.27 microns, so 270 nanometers. And they measured what the different types of equipment would think the particles were sized at using a low-cost nephelometer that I just mentioned before. This is the PMS 5003 in the pink line. And that's what a lot of these sensor companies are based on, is this Plantower PMS 5003 low-cost nephelometer. That's the pink line. The gray boxes are an aerosol particle sizer, sort of a lab instrument that is more sort of trustworthy in like how large the particles are. So if you look at the gray box, if we inject 0.27 micron particles, we get mostly particles that are either right at that size or slightly larger. All right, the particles grow a little bit, and so they don't stay exactly at that original size, but they're pretty close. Most of them are in this bin that is from between 0.3 to 0.5 microns. And if you look at the low-cost sensor, which is the pink line, it's doing pretty well for this specific case. It's getting that most of the particles are indeed in that smaller size range. You have some growth that tracks pretty well with the reference monitor. So for particles of this size, it works well. On the right, we have a instance where we injected, or again, shouldn't say we, the articles of this the authors of this article injected 2 micron particles, so much larger particles. And the reference monitor is detecting that very well. It says that, okay, this new distribution of particles that you sent in here are, 2 microns in size. However, the low-cost sensor is totally missing that. The low-cost sensor still thinks that the particles are similar to the smaller ones that are injected. And so therefore, there's not really good agreement here, and these type of sensors should be used with caution when we are talking about larger particles like PM10. This is from a paper a couple of years ago by the John Volkins group, and it's basically saying a similar story. So on the x-axis, we have the reference data from a Grimm EDM 180, a sort of high-quality monitor, and on the Y, we have various low-cost sensors, the Plantower, the Sensirion, and Piera. This is PM1 right here, and so for PM1, you see very good agreement. The dots here line up very well on the 1-to-1 line. So these dashed black line is the 1-to-1 line. Good agreement. These sensors can be used pretty well for PM1, maybe with a little bit of correction factor. For PM 2.5, it's still not terrible, but not as good. You can see that the statistics get worse, the R-squareds get worse, the root mean squared error gets worse, but still, something that's probably correctable with a small correction factor. Where it starts to become a problem is with PM10. So now PM10, you can look at, there's almost zero agreement between the sensors and the reference monitors, where they're just missing a huge chunk of the data. So some pros and cons for each type. The nephelometer type are skilled at submicron aerosol, but can't measure particles greater than 1 micron. The OPCs are not quite as accurate for PM 2.5, but much better for PM coarse. And they also give some limited size distribution. So why do sensors fail at measuring particles? Why do they have this problem? This is a slide from a paper by Mike Giordano. And basically, anything that impacts the refractive index of a particle, in other words, anything that changes the way particles interact with an incoming source of light, will impact the measurement for PM 2.5. So this is things like the shape of the particle, the size of the particle, the chemical composition of the particle, and then the environmental conditions, such as the humidity. Okay? Because the way that these sensors work is basically there's a light source and there's a photodetector. And as the particles come through this chamber, some of that light is blocked, either scattered or absorbed by the particles. And that could be, that amount that's blocked can be detected. And that is sort of what tells you your concentration. So this is again, just sort of a schematic of that. So a typical low-cost sensor looks like something like this when you open it up on the left. These are very, this is very small, like 50 micrometers across. Some particles come in, they pass through this laser, and then they come out. Put another way, you have sort of a light source. You have a lens that sort of focuses the light source. You have a light stop. You have the particles that are coming through. This is for more of like for an optical particle counter where you can get the particles to come through one at a time, hopefully, although even that's not perfect. And then you have some scattering that happens at some angle. You also have the intensity of the scattering over time. You can put all that together and do something called me theory, which allows you to, if given a certain particle density and particle shape and assume a refractive index, you can figure out the particle size and then figure out the mass of the particles and therefore get their concentration. Okay, so that's kind of our unknowns here, the particle size, and that's what we want to try to figure out. So because these sensors don't necessarily measure exactly what we want them to all the time, we have to evaluate their accuracy and evaluate their performance. And that's what we can do here with simple linear regression. This is actually multiple linear regression. This is from a paper by Carl Mallings. This is data from Pittsburgh, Pennsylvania through a project at Carnegie Mellon. And what they did is they developed a correction factor using multiple linear regression that was based on temperature and relative humidity that was able to adjust the data that was coming out of a raw purple air monitor, adjust it for bias and bias correct it so that it improved data tremendously. And so using this correction factor here at the bottom, the same data set displayed on the right gives you a much more accurate PM 2.5 estimate. And so the goal of what they did there was they basically created a calibration model that corrects the output of the sensor for various sensor sensitivities. All right, and so to do that, they had to co-locate the sensors next to each other. So they co-located the air sensor next to a reference monitor at the same location, measuring the same ambient pollution. This is what Afri-SET does as well. This is sort of the underpinning of Afri-SET. And they are able to basically take that side-by-side data and leverage the temperature and humidity data as well to create a sort of linear calibration model where the target is the reference or reference-like PM 2.5, and the features are the air sensor PM 2.5, the temperature, and the relative humidity. And if you do like a simple linear regression, you'll get these coefficients. You'll get the slopes basically, which in this case I'm calling A, B, and C, and then you'll get the intercept D. And those things are basically what end up being your correction factors. You can often do sort of what's called cross-validation to make sure that your model, your correction model is well suited to and not biased. And so to do that, we usually use something called K-fold cross-validation, where you sample a different 20% of the data and hold that out for testing data. All right. And so 80% of the data is used as training the model. And if you do a 5-fold cross-validation, that means you could have 5 different combinations of an 80-20 split of the data. And so you could sort of develop 5 different correction factors and then sort of average them all together. To validate the models and perform the models, I'm sure you'll be hearing more about this week from the Afri-SET team, but we often want to look at metrics that give you the idea of the strength of the association between the variables. That's something like R². And then we want to get something that gives us the bias or the error, and that's either root mean squared error, mean absolute error, or something like that. Normalization is very important as well. So having something like the coefficient of variation of MAE that's shown here on this equation is quite essential as well. Model performance. So we want to have low bias and we want to have high correlation. All right. So in this map here, again, from a paper by Carl, we have the CVMAE, which is the coefficient of variation of the mean absolute error. And then we have the Pearson's correlation coefficient R. And so we want to be kind of towards the origin of this map, towards high correlation and low bias. Here's a real world example of this kind of work that we did in Accra several years ago. That this was sort of a study that led to the formation of Afri-SET and the whole sensor evaluation center, where we tested 3 common sensors at the University of Ghana, just right outside where you guys are, the clarity, the purple air, and the modulaire. And so what you're seeing here is their performance against reference monitor, the Teledyne T640, which still is at the site. And then you can also look at sort of the statistics, how the mean absolute error in the R² was, and then using a simple correction factor like a multiple linear regression or even a more complex correction factor, what kind of improvement do you get? You can see that, for example, for let's take the clarity, since that's commonly used in Accra. If you just take the out-of-the-box data, you get an R² of about 0.69 and a mean absolute error of about 13.6. If you apply that multiple linear regression correction factor that we talked about, you get an R² of 0.74 and a mean absolute error of 2.49. So huge improvements, especially in the error and the bias metrics. I'm almost done. I know I've only got like less than a minute left, so I'll go quick. We have a tutorial for coding and for non-coding this methodology. So for correcting low-cost sensors, you can find it on my website. You can also find it on this QR code. I have a GitHub, which has the code for doing this correction factor. It also has the data. The data is based on a evaluation that we did in Accra, Ghana at the US Embassy, where there was a BAM 1020. So you can go to my website, or you can scan this QR code, or just take a picture of this slide if you want. I'm sure the slides will be shared afterwards as well. So you can get this data if you want to practice doing one of these on your own. So I think I'll leave my take-home points up here and turn it back over to the MC for any questions. Thank you.
Any questions, please? Okay.
Thank you, Professor Dan. It's Traore from Senegal speaking. Thank you for your nice presentation. I would like to to come back to the title of the topics. It was about sampling techniques, right? In your presentation, could you elaborate more about which type of sampling techniques you have used? Because I have seen it some model you develop regarding the instrumentation and detection part, but how do you overcome sampling techniques regarding the heads, regarding the field of measurement? If we compare urban zone or metropolitan zone or industrial zone, how we can use the sensor you have present to make a big or best choice for the sampling. My second question is about multiple linear regression. As we are talking about measurement of environmental monitoring parameters, which are all dynamics, why you choose to use multiple linear regression? Why you did not go over multiple linear regression like dynamic boost linear regression, just to see how parameters are changing within the environment? Thank you.
Yeah, thanks for those questions. I'll take the second one first. We definitely have used more machine learning type of calibrations. I just didn't have time to present that. We've used XGBoost. We've used pretty much every machine learning technique that's out there. You can certainly do that. There is a risk that you use these, if you're using like a neural network or something like that, you can quickly overfit your data and sort of not really understand everything if you're not careful about it. And especially as this is a sort of introductory presentation, I decided to focus on linear regression because that is well known and it's physically more interpretable, I think. But we've certainly done the different machine learning techniques, and sometimes they do have slightly better statistical performance if you just look at it sort of from that perspective. But usually multiple linear regression is not very far behind, if behind at all. The first question, sampling techniques. So yeah, the sampling techniques that I talked about were mostly about air sensors that use scattering, light scattering to measure particles. So that I guess I went over this slide pretty quick, but basically what you're measuring is extremely small voltage changes in a photodiode's output. So it's seeing like less light having been shined on that sensor, and it's able to convert that into PM concentration using some calibration curves. There's other sampling methods out there. The beta attenuation monitor, which is commonly used, it's on my screen right now. That actually collects particles on a filter. So it's somewhat gravimetric. It collects particles on a filter and then it shines or it blasts beta rays through the collection of particles on a filter, and the attenuation of beta rays is used to determine the mass. There's other methods that are purely gravimetric where you are just going out with a sampler, you collect particles on a filter, and then you take it back to a clean lab and you put it on a microbalance and you weigh it, and get the mass directly that way. That's sort of the old-fashioned way of doing it. There's all kinds of different sort of sampling techniques, and I think that the advantage of the sensors is that it's real time. All right, so you get like data from a sensor, you can get a data point every 1 minute. And that's really helpful if you have like rapidly changing air quality concentrations at like construction sites or at mining operations or nearby roadways where, a truck will come by and it'll be spewing, smoke fumes, and then it's gone after like 2 minutes. Those quick changes can be detected by these type of air sensors that give you this data. Whereas if you were collecting data on a filter, you know, that you have to collect particles for, you know, maybe 24 hours or a whole day in order to get enough mass signal to be able to get a concentration. And that's not really real time. That's, you know, one value over a 24-hour period. So those are some of the sampling techniques that we use.
Thank you for your presentation, Professor Dan. My name is Abimbola from Lagos. So I would like to know more about source apportionment, to know the sources of emissions. Like for Lagos, we in the agency I work with, we Transport Authority, so we focus more on transportation. But of course, we monitor the air quality. So we would like to identify those coming from generators, those coming from traffic and all that. So I would like to get more insight in that and the tools you use.
Yeah. Thank you. That's a great question. And I think source apportionment is one of the main reasons to do monitoring, because it's more actionable to be able to say this source is contributing pollution, where as opposed to just saying concentrations are high, but we're not sure like where it's coming from. So that's definitely one of the main things. There are some ways to do it with air sensors and with just monitoring. It's a little bit, there's a lot of uncertainty, I would say. And I think you're going to have a presentation later from James Nemo, who is going to talk about a method that I've actually used a lot across Africa, where we have done non-negative matrix factorization on gas and particle data in order to get at what are the different sources of pollution. And so we were able to identify like a pollution source in that is representative of traffic emissions, one that was representative of like cooking from fuels, from, you know, biomass fuels, solid fuels, wood, charcoal. And then we were also able to get a source of like long range transport. So in West Africa, I'm sure you're familiar with the harmattan dust. So as that dust comes in, that becomes a big source of pollutants, but it's of course highly variable and highly seasonal. I can put a paper, I'll put a link in the chat here, and hopefully and I'll just share my screen really quick so you can see what I'm talking about. But we did this paper a few years ago that was called Low Cost Investigation into Sources of PM 2.5 in Kinshasa, DR Congo. We're working on similar approaches in Ghana using the same technology. But we were able to basically take a sensor box and run some machine learning on it, unsupervised learning, and come out with a source apportionment methodology. So let me put that link in the chat, and hopefully the organizers can share it with you guys. You can also, this paper is openly accessible online, so you can also just feel free to take a photo of this slide that's on my screen right now. I'll also mention that I only talked about sort of the low cost, you know, quote unquote, lower cost ways of apportioning sources. The sort of traditional way of doing it is, there's a few ways. You can, again, collect filters, take it back to a lab, run a chemical analysis on it, put it through a bunch of fancy equipment, which will tell you, okay, you have this much metals, you know, heavy metals in your sample. You have this much organic material. You have this much black carbon. You have this much, you know, sulfate or nitrate. And once you have that information, you're able to talk about sources a lot more definitively, because we know, for example, that fires are a big source of black carbon, and you know, we know that certain metals are associated with mining operations and things like that. So there's many ways to do it. The most traditional way is also, unfortunately, the most complex way and most expensive way, but I do think there is some potential in low cost source apportionment or lower cost. And I think you're going to hear later this day or maybe this week from James about that.
Thank you very much for your presentation. We are grateful. Can we give him a round of applause for a wonderful presentation?
Thank you.
Thank you. This is going to be from Dr. Irene Opoku-Ntim. She's a senior research scientist and a senior lecturer who focuses on radon, indoor air quality, and environmental radioactivity, and the public health protection. She is affiliated with the Ghana Atomic Energy Commission and the School of Nuclear and Allied Sciences, University of Ghana. She's been actively involved in Ghana's National Radon Project since 2009 and is passionate about promoting radon awareness, environmental health, and the inclusion of radon testing, indoor air quality assessments, and public health policy in Ghana. Let's welcome Dr. Irene Opoku-Ntim. She is going to give us a presentation on understanding indoor air pollution beyond smoke and dust, the hidden risk of radon. Thank you.
Thank you for the opportunity, and I'm glad I'm given this time to give you this presentation, because I'm sure you've all been hearing about air quality, and all you're talking about is PMs, this and that. I've not heard since morning, nobody has even mentioned the word radon. So I want to ask, how many of us know of radon? How many of us have heard of radon or know about radon? Okay, 1, 2, 3, 4, 5. Look at the number in the room. So it's a great opportunity for me to share what radon is and its impacts on your indoor air quality and even the outdoor air, but I'll focus more on the indoor. So this will be the outline of my presentation. It's not going to be a very long presentation, it's short, so yeah. So I'm sure you've all heard about what air pollution is. So it's already been defined by previous presenters. But I want us to take, according to the WHO, 3.2 million people died in 2020 from household air pollution. And this is exemplified by the fact that indoor air pollution causes 4.1% of premature deaths globally. And we all know that we spend most of our times indoors, not just staying indoors. We go to work, we are indoors. So wherever we are, we spend most of our time indoors, and these gases that are indoors affect our health. And it's not only the PMs and all those things that you're talking about, but radon is also a factor that affects indoor air quality. So I look up about the source of indoor air pollution, and I saw all this from air moisture, asbestos, biological pollutants, and I found radon. So this was from the US EPA website. And you could see from the diagram, the figure 1, the sources, just showing the sources of indoor air, the pollutants as it gets into our homes. So also reading from the websites, the indoor radon, idahoradon.com, their website, I realized that there are many different contaminants that can be found in the average home, but they can mostly be divided into 5 levels. And level 5 pollutants are the most dangerous. Level 5 pollutants are the most dangerous. So danger level 5, dangerous gases. Then we have radon and carbon monoxide. Potentially are the deadly gases that exist in many homes. So what makes these gases of particular concern is that they are odorless, tasteless, and invisible. We cannot see them, but they are killing us. So together, radon and carbon monoxide are responsible for thousands of deaths every year. In fact, radon kills about 15,000 to 21,000 people every year, according to the US EPA. So the diagram shows you the difference between radon and carbon monoxide in our homes. So we have the level 4. I wanted to dwell on the radon, so we have level 4, that's the microbial growth in our homes, the fungus, including the mold, the mildew, all those in our homes. Then we have level 3, that is allergens and particulates. And we all know the particulate matters that we are all talking about, irritations, runny nose, congestion, and all those things that can be found in our homes. Then you have the infectious illness, that is level 2. So the airborne bacteria and viruses, someone has cold, you can also get some, and all those things can be found in our homes. Then you have the level 1, toxic compounds, that we all use these kind of products in our homes, and if it's in an enclosed space, you're inhaling and it's having effects on your health. So it comes to what I am more interested about, radon. So what is radon? So in the room, I saw a few hands up. So I just want you to know that radon is a radioactive gas. It's a natural gas that is in the environment. As we are here, we are all inhaling radon. We are inhaling it. And even we are in a very good space that we are inhaling more. So, and it's a decay product from uranium. So as I said, it's natural. Uranium is a natural element on Earth. So as uranium decays through the process to radium, radium will also decay to radon, and radon takes 3.82 days to decay. And after the 3.82 days, as radon has decayed, its daughters, polonium, lead, bismuth, those are the most dangerous because they are stable and get stuck as we inhale into our lungs. So according to the WHO, 3.3 to 14% of all lung cancer cases are attributed to radon exposure. So why is radon of concern when we talk about indoor air quality? As I said, it's known as a number 1, is a class 1 carcinogen according to the IARC, and is also, the radon health rate is 25 times greater for people who smoke and those who don't smoke. So if you are living in a house that has levels, so according to the WHO, your level should not be above 100 becquerel per meter cube. According to the US EPA, your level should not be above 148 becquerel per meter cube. That is equivalent to 4 picocurie. So if you have those levels in your home, so let's assume the level in your house is 100 becquerel per meter cube, that means you are smoking 8 cigarettes per day. So the impact of radon on our health. So as I said, as you breathe in radon, it emits alpha particles. So as these alpha particles, we all know we are scientists here. So alpha particles can just be stopped with what? A sheet of paper. So when you inhale the radon into your system, the lungs stop it. So as the lungs stop it, it stays there 3.82 days, radon has decayed, then its daughters are now doing the action on your body for you. So it deteriorates your lung tissues, and the end goal is you having the likelihood of you having lung cancer. So what are some of the entry points that radon can get into our home? So we have a nice house that we have built. So the soil gas concentration, the soil that you build on is very important. So the geology of the area that you are building your house on, you should know. As I said, it's radon. It's natural. There's nothing, you can't get away with it, but you can reduce the impact. So where you're going to build, you should know. So you should test before you build. Then the cracks and gaps, you've put up your structure already. But our maintenance culture, you see that it's a gas. So any small space that it gets, it can just crawl through it and come indoors and affect you. So if you've built in an area that has high radon concentration, that means the likelihood of radon building up in your home is high, and you are inhaling it every day. Then the usage of the building, including building habits. Do we open our windows? What do we do when you are staying home? People don't open their windows. We are building with all these fancy windows and all that. Ventilation is key. Then the season and weather, the same thing. Seasons affect the concentration. And from our research, we realized that during the rainy season, levels are a bit high. During some harmattan, levels are a bit high. Rainy season, because during the rainy season, we close our windows, we are all indoors, and that's that. During the harmattan, when the weather is very hot, you definitely open your windows for fresh air. The only way to know how much you are inhaling is to test. So I can't stand here and tell you that, oh, this room has 100 becquerel per. I'm sure you carry me and throw me out of this room. Yes. But if I test and tell you the results, then you know that this is how much you are inhaling. But when it comes to radon, we have short-term and long-term measurements. So usually when you call me to come and test your home for you, I'll probably do a short-term, but advise you to do a long-term. Short-term because you want your results now. But now is just at this moment, this is what you are getting. But the long term will give you over the months, over the days, how much you are inhaling. So we do the short term for you. Then later on, we have to do the long term to advise you on your annual radon concentration. So we have for short term, we have some detectors like the charcoal canister, we have the alpha track. So when you come to the Ghana Atomic Energy Commission, where I'm based, we are using the LR15, that is linen resin. I'm not sure, this is not something that I should. Then we have the CR39, that's the Columbia resin 39. Then we have the electrodes, which you also have. And we also have the long term, so alpha track detectors, that's the LR15, the CR39s, they are mostly used for long term. Long-term detectors are detectors. So when it comes to detectors, we have the passive and the active. The active detectors are the ones that are being powered by batteries, by electricity. That's why they are used for short-term. Then when it comes to long-term, use the passive detectors that you can just install and leave it for the number of days, sometimes up to 1 year. Then you come for it. Then you can go and analyze in the lab. So I'm just showing some. So when it comes to our lab, we have the electorate, the one that I've given the double star, that is here. And we have the earth, and we have these ones are short-term detectors that I put there to give you your results as and when you need it. So I'm showing you this. You see our innovation. So we've been using, we've been buying detectors for a long time, and as a country, I think it's high time we have something that we can also call our own. So I've been working with a lot of students, and I'm sure that the Department of Physics can attest to that because I've been supervising some of the undergraduate students. So this is one work that I did with one of my master's students. He was very good in electronics, and I said, why don't we come out with something that we could also use to test radon in Ghana, low cost. So this is something that has been designed. We are still working on it to improve upon it. We've been to several conferences, and we've been advised to, since it's indoor air quality, why don't we incorporate PMs into it? So whilst it's monitoring radon, it's also monitoring the PMs. So this is the second step that you want to do, and also want to try and make it a bit smaller that we could carry around. But for now, this is something that we have developed for Ghana. So when it comes to the radon levels, it comes with guidelines, and I think I said previously. So according to the WHO, the 2.7, this is measuring in picocuries, that's why it's 2.7. So it's becquerel per meter cube. The US use the picocurie, then the other standards use the becquerel per meter cube. So if it's 2.7, no action. That's below 0 to 2 to no action is required. Then in between 2 to 2.7, consider fixing your home. Then 2.7 to 4, you consider. Then if it's above 4, you fix your home. Then, as I said, you can't get away with it, but you can mitigate. You can reduce the impact. So the first way to mitigate is proper ventilation. And currently we are all building sliding windows, closing up. We move from the home, we go to the office, we've closed up. I'm sure for a week, for a month, windows have not been opened. But from today, please, make it a point to open your windows. You wake up in the morning, open windows for fresh air before you leave the house. When you come back from the office, you do the same thing. When you get to the office, open your windows for fresh air before you close up and put on the air condition. So some of the mitigation, so you call me. Yes, me, you call me. I come and test your home for you. Then I realize the levels are above the accepted levels. Then you ask me, so what do I do? Should I leave the house for you? No, don't leave the house for me. I don't need it. So what I can advise, the first step is proper ventilation. Maybe you're not doing that. So maybe I can give you a month or 2 to do proper ventilation in your home. So if you do that, I'll come back and retest. If I retest and see that the levels are so high, then we have to start putting in other mitigation measures. We have something that we call the soil depressurization system, where we install vents into your home so that it will suck out the indoor air, then bring out outdoor air. So there will always be exchange of air in your home. Or you are building, as I said. So please, those of you who have bought lands, see me. I won't charge you, like the level will be low. I won't charge a lot. So please see me and I'll test your land for you before you build. So we test the land and realize that the levels are high. What do you have to do? First thing you have to do is, when you are laying your foundation, when you are casting your, casting the concrete, or that's how they call it, right? You cast it at once. You see, now people don't have money, so they'll do some, and maybe later on they come and continue. You cast your foundation concrete at once, so that there will be you don't have any chance for gaps in between. Or the next thing, if the area has a lot of radon, there's this, people have been doing it, but we are doing it to prevent damp, for damp proof or something. We have this rubber that we lay on before casting the concrete. So you lay it, then you cast the concrete at once, then you build. Or if there's concentration is high, another thing that we can do is you build with raised foundation, so that there'll be gap. Before the air gets in, it has reduced the impact before it gets into your home. So we build a raised, and I've seen some of these kind of buildings in some places in Accra, that you can even park your car under those buildings. So you build with raised foundations. So these are some of the things that you can do to reduce the impact if I come and test for you. So I'll be waiting for your calls. So these are some of the radon works that has been done in Ghana. I mean, this is about we've done some work, but we've done a lot of work now, not up to the number that we want, but this map was drawn in 2019 after we've gotten some data. And we can see from the legend, from yellow to red, red means high, then the yellow is low. So I want us to see the one on the right is for indoor, and the one on the left is for soil. And the one on the left is, indoor, and here is soil. So the indoor, I want us to look at the indoor and tell me where you can see red. I mean, which region can we see red? Okay. So I think we see red in Accra, red in Cape Coast. I mean, based on the work that we've done. But I want to talk a bit about the correlation of radon and earthquakes. Radon is linked with earthquake. So areas that have earthquakes have high radon levels. Because, and I said this morning to someone that radon is also one of the good side of radon. You can use it to predict earthquake. How do we use it to predict earthquake? When earthquake is about, if maybe you've stationed a monitoring system at a place, monitoring radon over the years, and you see that the levels keep going up, that means the likelihood of an event happening is high. So this is one of the advantages of radon, whilst it's killing us, but also has an advantage. So it's used for volcanic activities. Yeah. So just to show you, so when it comes to Ghana, we've done a bit of work. We all know of earth tremors that we hear at Kaswa, Wager, McCarthy Hill, those places. And with the constant works that we have done, those places have high radon levels because they are sitting on the fault lines. Yeah, so. But you can build and prevent. The key is proper ventilation. Please, let's have proper ventilation in our homes. So indoor air pollution discussions in Ghana often focus on smoke and dust. So at least today, I know a lot of experts are here. So when we go out, there's a lot of information of radon online that we can have access to. It's free. So when we are talking about our indoor air quality, please let's incorporate radon into it. Radon is rarely included in routine indoor air quality assessments, and I'm sure we do our PMs, we don't do radon assessments. Studies in Ghana have reported elevated indoor radon levels in some areas. Public awareness and testing remain limited. Funding is key. We need a stronger environmental monitoring and policy attention. So my call to action. Radon can be found in the air outside and can build up inside buildings and homes. If your home level is at or above 100 becquerel or 148 becquerel, contact a qualified professional like me. Even if your radon levels are not above, consider increasing ventilation and sealing cracks in your home. Consider retesting your home every 2 years to be sure radon levels remain low. Also, retest your home after any remodeling. Thank you.
Thank you very much, Dr. Opoku-Ntim. Any questions for her? I have been particularly very scared listening to her presentation I kept asking myself, what is the percentage of radon in my home? So, any questions? Where is the microphone? So, Doc, let me ask my first question. Apart from testing, is there any other way we can know we have radon in our home?
No. The only way is to test. It's with us, but the levels, yes. So if you don't test, you wouldn't know.
Thank you so much, Dr. Irene. My name is Paul Onwachuku. I'm the founder of Colibris. Dr. Colibris, yes, we are into dedicated to the improvement of air quality in communities. We are based in Kaswa Central Region. Doc, we've been already battling particulate matter. Understanding is killing people, and we've been, struggling to, put up our measures to help our communities. And today we are hearing about radon, which is, and you are telling us is on level 5. So anyway, what I want to find out is, have there been any form of research on radon? Looking at some of the environmental challenges. I know you made mention of Accra where it was red. So I was thinking, the Western region where we have a lot of activities on the soil like Galamsey, we didn't see anything there. Does it mean those environmental challenges does not affect, cause radon in any way? That is one. Then the other question I also want to ask is regarding do trees in any way help in our home to maybe help us also suck in this radon to help us also in our homes? Thank you.
All right, thank you. I'll start from the second. So the trees, I won't say they suck, but maybe for good air in the environment, trees are good. Then when it comes to your second, your first question, you talk about Galamsey and all those things, the works. As I said, this work was done way back. We have a lot of data, and we are still collecting data from these regions. This is just, this work is like, let's say 10 years ago. So we are still collecting data, and we are updating the map probably this year or next year. So Galamsey activities and all those things affect because they are turning the soil and the gases are coming out. So it's affecting it, and we are working on it. As students, we need money, because if I put a student at to go to the Western region, I need to fund the students to go there to do the work. So if we get more funding, we are currently University of Ghana, I'm working with most of the students, but it's free. We are sponsoring the students with our detectors to go out there and do the work. And most of the students, if I have to send the students to the Western region, then I need to foot the bill of accommodation and all those things. But we have other institutions that collaborate with us, especially with the North. We have the UDS. When you go to the Cape Coast, we have the UCC also collaborating with us, also doing some works for us to get the data. It's the data that we need. So yes, it affects, and we are working on it to get people on board. So we are here to collaborate.
Thank you, Dr. Irene, for the insightful presentation. My name is Abimbola from Lagos. So I would like to know what impact radon has on transportation, like in-cabin transports, like big buses, like in Lagos we have the BRT buses and all that. So I'm trying to figure out if there's any
Okay, so I wouldn't talk about maybe radon. Maybe if the gas is packed there, outdoor. When it comes to radon, outdoor concentrations are not too much. We are still concerned about the one indoor because the gases gets trapped in an enclosed space. So if maybe let's assume the gas is packed, the car is packed in an area that has high radon, then the car is closed. That's when maybe radon will build up in the car. But ideally, once it's okay.
Doc, thank you very much for your presentation. I'm interested in the data aspect. Is the data publicly available, or if I need the data for some kind of analysis, how can I have access to that?
Okay, currently the data is not publicly, but we have published. I'll say it's available. We have published. Just we can Google radon works in Ghana. All works that has been done by students, by us, they are all available online. Unless maybe the journal that's one published, you have to pay for it. Otherwise, all the data is available online.
I'm asking that question because maybe if I want to use that particular data to do an analysis and compare with other variables, to be able to look at the two. So the published papers that you are talking about, I don't know whether the data is part of those published distance.
Yeah, I get, yes. Where we put the data in there, maybe sometimes in averages and that's, but if you need, you could come, then sit down, maybe for research purposes, we could help, yes.
Are there, sorry, are there ways of like putting all the data together in one way, a hub or place, so that it's easy to collaborate or coordinate the information from the various aspects? Because you said various students are collating this data. And my second question is, are you covering the entire region of entire country, or it's just concentrated in some areas of the? Thank you.
Okay, so this is one of the things that we are working on now, to create an online data pool so that people could just go and get the areas and all that. That's why it also helps us to come out with the map. It's something that we are working on. Yes, and our aim is the whole country. Is not any particular, our aim is the whole country. And even when it comes to Accra, there's little that we've done, depending on the data, because it's all funding. We need money to do this. And as I said, the detectors are very expensive. That's why we are trying to come out with our own. But if we get funding and everything, we could cover the whole country.
Okay, we have one question and someone online, an online participant. So Conlan, please, can you ask your question? Or mute yourself. We are listening.
Okay, can you hear me?
Yes.
Yes. So I'm Conlan Salary Park from Technology Refinery. So Doc did mention that he explained linking the presence of radon with uranium decay. So my question comes in this way: does the presence of radon within an environment indicate the presence of uranium deposit within the environment in which it is detected?
So yes, radon is also used for uranium exploration. So places that have high radon could be a place for uranium deposit. So it's linked, yes.
So, and in terms of the mitigation, so would you advise that planting of more trees within the environment could help purify the home to reduce the impact of radon to indoor air quality?
Yes.
trees could help. It's the geology of where you are building. It's the most important. So if the area is a high granitic area and you're even planting the trees, it still contains high radon levels. But at least, as I said, ventilation is key. If you're able to purify your air, it helps reduces the impacts.
Okay, thank you very much for the presentation, and I've really learned a lot during this session as well.
Thank you.
So, Doc, thanks a lot for the presentation and the enlightenment. I believe we all have learned a lot today about radon, and I want to thank you also for working with a number of our students on their projects to look at radon in different environments. Currently, I think one of your students has come to deploy your sensors in our offices in the department, and I eagerly await the result, because I've been sitting in that office for close to 24, 25 years, and I don't know how exposed I have been. And so we are very grateful to you, the Department of Physics, University of Ghana, for the work that you have done within the university setting and also the surrounding areas. So we hope that our area will not be high in radon. Thank you very much.
Trinity.
Thank you very much, Doc. In fact, I think your presentation has been one of my interesting and at the same time scariest one, because it kept me thinking. Thank you so very much. So we are done for the day. We'll go briefly for our snack, and then we have a tour to the University of Ghana, where we are going to have a look or visit the Afri-SET evaluation facility. So those who have never been there before and are interested can join a bus downstairs to have a tour and see what exactly Afri-SET is all about. And then we want to also say a big thank you to our online participants who have been with us from the beginning of today's session till the end. We are so grateful. We hope you join us tomorrow morning. It starts at exactly 9 o'clock. So we hope to see you online to join as we take tomorrow's session as well. Thank you so very much.